that's a little bit different, are we allowed to do that? Or once it's voted on, it's over and done?
Once the decision is made on an issue that's properly made a motion and seconded, and you discussed it and the decision's made, you can't come back and revisit it unless you were on the prevailing party to pass it. That's about as simple as I can get. I'm sorry if I haven't answered it. And
Yeah.
It's hard to deal in hypotheticals.
You know,
So
and again, I'm just throwing this out. I'm not thinking this at all. You know, if I want to make a motion that we not play sports at all, and I'm not saying that, I'm just using that example. When would a motion like that come up? Now, later?
Now is not the motion. Now has got to deal with what the agenda is. If you don't have an agenda, then you might as well just pack it up and go home. So right now we're dealing with what the agenda is. If you want to make a motion at the appropriate time, which is whatever the agenda has been dealt with, then please do. And at that point in time, if the chair asks, I'll be happy to give a ruling as to whether I think it's appropriate or not. But I guess what you're asking is, if you don't do it now, is it foreclosed? No.
Okay, so later on I can bring up a motion about when we should start and stop or something like that. I just want to get clarification.
Yes, that would be my interpretation. As long as you didn't vote in the losing party the last time.
in other words, to change, I'm sorry,
No, go ahead.
to change the date of the 27th, you would have to have been one of those who voted for the 27th.
That's correct.
Okay.
Mr. Ireland, can I ask that you either turn your microphone up or if you could potentially get closer? We have a hard time hearing you sometimes.
I was asked to do that and I thought I'd done it. Is this better? What I'm turning up is what I have here. As far as when I look at the screen or the whatever it tells me on the screen, all my volumes are up as high as they can go. Is that
Okay.
better? Is that better?
Slightly. We'll work with it. Thank you.
All right. Well, let me know if you just can't hear me. I'll be happy to let you know.
Thank you. So Mr. Finlayson has withdrawn his second to the amended agenda. Mr. Schusterman, are you raising your hand?
Yes, I'll second it.
Thank you. Is there any further discussion on the agenda? We have a motion and a second to adopt the agenda with the inclusion of new business, executive director comments, board member comments, withdrawing an agenda item that I submitted regarding the fall sports calendar, and to accept the report of the SMAC recommendations. All in favor, please raise your hand.
I need a good count here. Leave them up, guys. I believe I have 11, Ms. Rohr, and 11 to adopt that agenda.
Those opposed, for sake of the record.
Leave them up, please. Am I missing? So I know I missed Mr. Thomas on that. I bet Mr. Thomas, was your vote in favor of the motion or against the motion? Jamie and Justin, you were carrying that. I've got 4 against the motion right now. I really need 5. Here are the ones that I have against the change agenda: Johns, Tortora, Finlayson. And who else was opposed to the agenda change?
McLean.
McLean. And it must have been 12 to begin. We must have missed Mr. Thomas to begin with.
Mr. Thomas, you are unmuted now. Was your vote to support the approval of the agenda?
That is correct.
Okay, 12-4. Johns, Tortora, Finlayson, and McLean. Okay, thank you.
Thank you, sir. Getting into our action items, the first one being to accept the report of the recommendations indicated in the Sports Medicine Advisory Committee. Ms. Patrica with a motion and Dr. Longshore has seconded that. We will open it up for discussion.
No, that's not my motion.
Oh, I'm sorry.
Am I off? Yes, I am. I'd like to actually address one specific part of the SMAC report. And my motion is a little bit lengthy, so I'd like if I could ask the board to follow along with the board packet, the bottom of page 4 and the top of page 5. I have this motion written for the secretary, so I can email it to the secretary. I move that the FHSAA Sports Medicine Advisory Committee recommendations regarding the delay of football and volleyball as detailed in their July 23, 2020 report be adopted as the official guidelines of the FHSAA with the expectation that individual school districts will follow these guidelines for these sports effective immediately. These recommendations include A, delaying the start of football and volleyball until 2 to 3 weeks after brick and mortar schools are opened, and B, delaying the start of football and volleyball until a county has less than 5% positive COVID-19 results for at least 28 days using the Florida Department of Health dashboard and reevaluating this metric every 2 to 3 weeks, and C, requiring at least 2 weeks of practice before competition to allow for appropriate mandatory heat acclimatization, I'm not good at saying that word, measures, reintegration into sport, and to minimize the risk of overuse and injury. That's my motion.
Thank you, ma'am. Do we have a second? Mr. Schusterman has seconded Ms. Patrica's motion. I don't know that I can attempt to repeat that motion. Hopefully, if there are any questions, we can always refer back to Ms. Patrica as we now enter discussion. Mr. Finlayson.
Just a question in regard to point of order in terms of what Mr. Tomlin and Mr. Ireland said previously. Just to clarify, this is in opposition to a motion that we did approve on our previous meeting. So just to confirm, Ms. Patrica and Mr. Schusterman were both on the prevailing side previously.
I can address that question. Mrs. Patrica was on the prevailing side. Mr. Schusterman was not on the prevailing side. So there is evidently Mr. Schusterman would not be able to second that motion.
And I'm not sure that this motion contradicts that anyways. I mean, schools can still start on July 27th if they meet the SMAC guidelines.
And yes, ma'am, I understand that. I'll let the board discuss that. I'll let her see if there's a second first.
Okay, I will yield to Mr. Ireland's judgment in regard to that. And I just want to make sure we're following proper protocol, Ms. Patrica. I certainly appreciate.
According to what can you hear me now?
Yeah, yes, sir.
According to Robert's Rules of Order, section 37, that a motion for reconsideration, which if it is a motion for reconsideration, can only be made by a member who voted with the prevailing side. It says nothing about second. So that's it's quiet on that. So I don't think that would stand. I think it's a proper motion.
So we do have a motion and a second.
Thank you.
We will now open the floor for discussion on Ms. Patrica's motion. Ms. Patrica.
So a lot of the information I'm going to share with you now is information that I will share with you later when we talk about volleyball and football. I've spent a lot of time talking to doctors and nurses. I spent a lot of time talking to Dr. Maynard as well to understand this. I'm really grateful that the board gave us time to digest this and figure it out. I've looked at the requirements set forth in the SMAC report. I am loath to ignore those. I think it would be irresponsible for me to not take those recommendations to heart and make them expectations for our counties to follow. That being said, we have one county in the state of Florida right now that is below 5%. We have 27 counties that are between 5 5% and 9.99%. I want to say we have 38 counties that are above 10%. And we only have one mega district that is in the 5 to 9.99% range. I don't see a sort of a way forward for these two sports in the fall. That's for discussion later. The discussion right now is erring on the side of caution and making sure that we're providing the safest environment possible for our students. And I don't know how we ignore the advice of the medical professionals on SMAC and reject their recommendations in this regard. Those are my comments. Thank you.
Thank you. Dr. Longshore.
Thank you, President Otero. I'm going to have to leave in just a couple of minutes to go to the graduation. And if the meeting continues like it did on Monday, I'll finish graduation and join you at the end. But I would like to read a statement for the record. Again, like Dr. Patrica, it's a little long, but I have submitted that letter in writing as well. I do appreciate your consideration, allowing me to share my thoughts. After having time to read the report from FHSAA Sports Medicine Advisory Committee thoroughly and speaking with a number of superintendents across the state, it is my recommendation that FHSAA support the recommendation from this document. This guidance will be extremely beneficial as superintendents and school boards across our state make decisions about the safety of our student athletes returning to sports competition. There's great diversity from district to district throughout the state. However, it is my belief that the safety standards recommended by SMAC will help mitigate the risk of COVID-19 spread amongst our student athletes, coaches, officials, and community at large. Recognizing that the Sports Medicine Advisory Committee is comprised of doctors and athletic trainers, I believe this board must look to the medical experts to provide guidance when making decisions about our students' safety amid a pandemic. I would like further clarification on the benchmark set for recommendation 1 regarding how SMAC determined the below 5% positive COVID-19 test was the appropriate marker. So maybe Dr. Maynard might be available to speak to that. Is this a generally understood principle that this particular percentage provides an opportunity for less COVID-19 transmission? The health of our athletes is of paramount importance. The endorsement from FHSAA of the COVID-19 recommendations made by SMAC would certainly place the safety of our athletes as a top priority and provide superintendents across our state outstanding recommendations to make wise decisions. So respectfully submitted, and I appreciate you listening to that. I'll be leaving in just a few moments.
Thank you, Dr. Longshore. To address your question of Dr. Maynard, if we at this time could include Dr. Maynard in the conversation so that Dr. Longshore could hear her input.
Thank you so much.
We'll bring her over now, Ms. Otero.
Thank you. Mr. McLean, if we could wait until further comment until Dr. Maynard has had an opportunity to get on and address Dr. Longshore.
Okay, because I just had a question about Ms. Patricia's motion. A little clarification. Can I ask?
If we could just wait until Dr.
Okay.
Maynard has had an opportunity.
All right, okay.
See, her name has popped up. There she is. Hi, Dr. Maynard, if we could turn the floor over to you.
Thank you. Can you hear me okay?
We can, yes.
Okay, perfect. So thank you again for having me. I do appreciate everyone taking the time to read the document that we provided in more detail and have more time to come up with these very excellent questions, because there's a lot that is not necessarily easily understood with epidemiology, and I do not claim to be an epidemiologist. I am a physician, and I use the guidance of colleagues and the data from reputable resources, including the Florida Department of Health COVID dashboard. So To answer the question about the 5% positive, the World Health Organization recommended a 10% positive for opening of certain businesses. The 5% is a more conservative number. There are some guidelines out there to not even open schools until 3% positivity rate. So, we are kind of going in a safer zone than the 10%, but not necessarily as low as the 3%. So when you're thinking of the positivity rate, there's a couple things to keep in mind. It's looking at the total number of tests that are done and then the positive tests out of that. To the simple math is that. There's been a shift, as I mentioned on Monday, from requiring follow-up testing for those positive tests. And so there's a possibility with the data that's being provided to the Department of Health at a state and national level, that we might start to see potentially a decreased trend in this percent positive, as hopefully they're only reporting single cases. So I did get a few questions on email over the past couple of days about this exact term. So we want the actual cases. We don't want inflated numbers based on repeat testing and persistent positive. So as the CDC has shifted their guidelines to now recommending a time and symptom-based strategy for releasing folks from isolation, that should hopefully help those numbers too. But the bottom line is just what Ms. Patrica brought up, is that, it is quite concerning that with the data as it stands now, that really only one county would meet our guidelines. So the thought behind the 28-day trend also is it's basically the 2 incubation periods. So I don't know if my message was clear enough last time. So if you think of someone that has been exposed to COVID-19, they have anywhere between 2 and 14 days to develop symptoms. So if they are properly isolated and on their own self-quarantine, that hopefully is not an issue. But if they are pre-symptomatic or asymptomatic and don't know that they're actually shedding the virus, then any time between that 2 and 14 days, they could spread the virus to someone else, who then on top of that would have another 2 to 14 days to express symptoms, virus, and everything. So the 28-day recommendation is based on a safety period of 2 individual incubation periods. So, we could say perhaps 21 days would be sufficient, but I would be remiss to go below that. So hopefully that helps to clarify why we chose 5% and the 28 days.
Dr. Longshore.
Thank you. One other question within that 5% that we're looking at, is that based on all ages, or would there be a targeted in the age bracket of the students that would be playing, or our athletes that would be playing?
So that's a great question. I would probably say it should be all ages. And the reason is because we can't necessarily say that 15-year-old won't go home and expose their adult parent or grandparent or guardian. So I think the other thing to consider when you see a number hit the Florida Department of Health as a recorded case, that was probably based on an exposure that happened a week to 10 days ago. So the numbers we're looking at are actually somewhat delayed based on the actual exposures. Another reason to wait that safety 21 to 28 days. So to answer your original question, I would still look at the total number, but that Florida dashboard is actually quite interesting, and you can click on the individual counties and you can see it's our high schoolers and the 20 something year olds that are driving this right now. And again, the study that came out from South Korea does show that the 10 to 19 age range can spread the virus just as much as adults.
Go ahead, Dr. Longshore.
I'm so sorry to take all the airtime, but I know I only have a few moments. The only other question here, as you had in the benchmark, the downward trajectory, but you're still wanting that, even though they might be a tremendous downward trajectory, the opinion from SMAC would be it still would need to be under 5%.
I think, if we can approach 5% at, if it's 6%, but we're seeing that the trend is continuing to go down, I think we can make, some adjustments here and there. I would not say a 10 or 11% adjustment would be necessary, but approaching the 5%, seeing a very nice downward trajectory and holding steady, if not continuing to go down over that 21 to 28 day, is really the safest way to make sure that you're not going to see another jump. And we could see another jump, and that's why we recommended waiting for the potential school exposures too. So just something else to keep in mind.
Thank you for your information.
No, thank you for asking.
Thank you, Mr. Tora.
Thank you, Dr. Maynard, for being here again. I have just a quick question. When we're talking about less than 5% positive, are we talking about county for county, or are we talking about the entire state? If we get to the 28 days and 30 counties or 20 counties are in great shape, but a few are not, are we still trickling down the road? I didn't put that quite well enough, but I think you understood.
Yes, I understand what you're saying. So our original recommendation was for the entire state, understanding that there are certain areas of the state that might be driving the numbers higher. But our original recommendation was for the entire state. Now that it seems that individual districts and counties are able to make the decisions on their own, we want to make sure everyone is armed with the appropriate data. So now we can start looking at state by state, understanding, however, that once competition starts happening, there may be some crossover. So if you are in a county that has a nice low, less than 5% rate, and you're playing a county that has maybe 7, 8, 9, 10% rate, there is a risk that there's transmission between the teams, and then that can potentially spike an outbreak too.
Mr. Tomlin.
Thank you, President Otero, and thank you, Dr. Maynard, for being here and giving us some clarification on that. As the board deliberates this issue, I want to throw out a couple of issues that are going to follow up should you go down this road. Mr. Tora briefly touched on this when she asked about the county issue. Keep in mind that 1/3 of our schools are private schools. And so the question that you are going to have to resolve is, does the private school that resides inside that particular county have to follow the county regulations? And then the next thing I think we're going to have to do, and I'm not sure how to do this, but there's the possibility that this number, whatever it has to be, needs to be school by school and not necessarily county by county, because there could be schools that are quite a great distance apart. I realize the only official mechanism for measuring would be the county health department, but I know that's going to be a question that comes up. The other question that I pose to this group as you ponder this and consider this is, who is going to be the collector and monitor, the collector of that information and monitors that information and makes the determination of when a particular school and or school district is permitted to return to play. And that's a big issue, because our particular staff has no expertise in that, nor we can certainly collect information, but there is no mechanism set up to report that mechanism. And then the final thing I'd like to say, and I appreciate Dr. Maynard's comments, especially in reference to trends. In other words, if a county or a school is trending downward, I do have to have a little bit of a smile on my face here when I say this. This association technically does not deal with trends. If a student's grade point average is below a certain area, that student athlete is not eligible. Even though it might be trending upward, that student is not eligible until it actually does reach that particular flashpoint, so to speak. So those are issues that I think that this board needs to consider as you move forward in your deliberations for this particular motion that's on the floor.
Thank you. Ms. Patrica, if I could ask you a question about your motion to what Mr. Tomlin was just pointing out in Mr. Tora's comments, is that I'm asking you in your motion from Dr. Maynard's recommendation of the state, a less trending down towards 5%, being at 5% positivity rate, is your motion for the entire state to be of that trending 5%?
No, my motion is county by county.
Okay.
County by county determination. And, the reason why I use the language official guidelines with the expectation that districts or county districts will follow those guidelines is because the FHSAA does not have the capacity or the expertise to do this. And it's part of the conversation that I had with Dr. Maynard where we discussed that. Like, what about, we have a large committee. It's not really a committee, but a large group of physicians who are advising our superintendent on a daily basis. And we could easily say to them, hey, can you take this on? And so we talked about it, and she walked me through the dashboard, the Department of Health dashboard. And it's really easy once you figure it out. Once you figure out where it is, it's really easy to find the data for your county. You just click on your county and it's right there. The only downside to that is it is 6-week trending data, and this is a 28-day trending data recommendation. So I would beg the connections of Chancellor Oliva to see if we could somehow work with the Department of Health to provide feeds to our schools and our districts regarding 28-day data coming out of the DOH for percent positivity rates.
Thank you, Ms. Patrica, for clarifying that. Mr. McDaniel, you had your hand up.
For clarity, can we get from Ms. Patrica a clear understanding of what she read versus the document that was shared by SMAC? Because I'm not sure I understood all the different variations that she's recommending.
The only real thing that I added that wasn't in there was the use of the Department of Health dashboard as the source for the determination of below 5% positivity rates.
But you also just said it's county by county, not state. So are there other differences besides those things? Okay.
Thank you, Mr. Finlayson.
So I'll have a lot of questions as we go on, as you won't be surprised. But and I still am a firm believer that these are local decisions best left in the hands of each community and each school working. I trust our educational leaders working in conjunction with our healthcare leaders to make those decisions. So again, that's my opinion, and I certainly respect others' opinions as well. But Dr. Maynard, I do want to clarify, you mentioned on the low end, there are recommendations to not reopen school until 3%. That's just one recommendation. Could you tell me what you have seen on the high end? What's the high end of percentage? Because I think in fairness, we don't want to be, right at the low end when the high end may be much larger.
To be honest, I don't know that I have seen the Department of Education have a cutoff point. I have not really looked in the state of Florida to see if they did. So if anyone is aware of it, I'm happy to hear it.
I thought you were quoting healthcare recommendations from healthcare experts. What source was the 3%?
3% was in discussions with some of my epidemiology colleagues, so I did not actually see it in print.
So there's no official recommendation on that. So
I don't know where that recommendation was from. No.
All right, so that's difficult information for us to consider if we aren't able to
Understand.
Okay, and a little misleading for me, but that's okay. So that's my big concern is we're looking at a 5% to be close to a 3% mark. And I'd love to see that recommendation, but also, again, there's lots of recommendations on what that threshold is out there. So that's a difficult number for us to wrangle with, I believe. But I'll have other questions about different aspects of Ms. Patrica's motion. But thank you again, Dr. Maynard, and please don't misinterpret my disagreement with lack of appreciation for your work. I can't tell you how much I appreciate all the work that you've done.
Thank you, Mr. McLean.
Yeah, with Ms. Patrica's motion, I just want clarification. At one time she mentioned moving everything back according to the SMAC committee. But in there also, she mentioned she mentioned July 27th, that people could start July 27th. So I was kind of confused because on one time, I just heard July 27th in there, that if they're below that thing, they can start. Is that what you meant? Like, so the one, you said we're going to move everything back 2 to 3 weeks, but then you said if they're below the moving average, they can start the 27th. And then with Dr. Maynard, so you're saying 2 to 3 weeks after the start of school. So if school A starts August 10th, they got to wait 2 to 3 weeks. If school B starts September 1st, they have to wait 2 to 3 weeks. Is that what you mean in that, reevaluated incrementally 2 to 3 weeks after the start of school? Or are you going to have a average start date for the state or the counties? Or the regions?
Ms. Patrico?
So, Mr. McLean, is that how I say your name, Mr. McLean? So you're right. A school would not be able to begin on July 27th if these guidelines are adopted, because they would have to wait until they open brick and mortar schools and wait that 2 to 3 week period. Does that answer your question?
Well, but the SMAC committee just talked about football and volleyball, right?
Correct.
And that's what I'm trying to make sure we're all on the same page when we vote. Or are we talking about moving everything 2 to 3?
No, just football and volleyball. I believe those were 2 sports that were in my motion, were they not?
Yes, they were.
Yeah, just football and volleyball. That's all I'm talking about here.
Dr. Maynard?
So just to clarify the 2 to 3 week recommendation, again, it's for that incubation period and to see if potential exposures happen during school. So, and I would encourage, no matter what is decided, that the data is continuously followed throughout the school year, because there are likely going to be spikes throughout the school year as we enter flu season and everything like that. So, I think that it's important that, again, the numbers that appear on the Department of Health website, they are likely to have been exposed a couple weeks prior to that. So if you look at the data on the day the school opens, understanding that that date has vastly differed now amongst the entire state. If you look at the data on day 1 of school opening, and then you look at the data 2 to 3 weeks later, if there were to be exposures during that time, you would likely see an uptick after the school opens. Hopefully that's not the case. I'm really hoping that we are opening schools in a safe, mitigated environment, and we do the best we can. But that's where that 2 to 3 weeks of reevaluating the data comes from.
So if school A opens August 10th, they can start practice. School B opens August 31st, they can start practice in, or do they have to wait 2 to 3 weeks to start practice? I'm just trying to find out what the 2 to 3 week thing, does it mean once school starts, you can't start practice for 2 to 3 weeks, or once school starts and you start practicing, then we'll reevaluate it in 2 to 3 weeks? I just want to make sure that the whole board is clear on what we're going to vote on.
From my understanding of Ms. Patrica's motion, and she can correct me, after school starts, then it'll be 2 to 3 weeks. And she said that's correct. Mr. Johns, did you have your hand up?
Thank you. I tried to wait a little bit. So just a couple points. First point is, we were real tied into the SMAC report, which I understand. I do want to point out that, we have had a lot of things like this come before us, that some we supported, some we did not. One comes to mind, which is very important, is the Zachary Martin Act that, we came to us for 3 years in a row. We never did adopt it until we were forced to adopt it, even though we had kids dying on the football field in that situation. So I think it's, for people to say that I don't care anything about what the SMAC report says, that's not necessarily true. I have to take it in context and the way we've looked at those reports in the past and the decisions that those folks have made in the past. My problem here with Ms. Patrica's motion is I don't see how we can see how I can word this. If we do this, if this is a decision that everybody makes, we have to join that, in my opinion, with the moving of football to a different sports season, which I know Ms. Patrica is going to bring to us later. So just so we understand as a board, you cannot do this and play football in the fall. Okay. And I'm going to give you an example of that. All right. If a school begins on August the 24th, which is kind of in the middle of where schools are beginning. Okay. If we're beginning on the 14th, some people are not beginning till the end of till the 31st. So I picked the 24th because it's kind of in the middle. Okay. There are still some school districts that have not set a start date. Okay. So I don't know how we can accommodate them, but I'm going to give you a timeline that I think everybody needs to understand. School A starts school on August 24th. First practice, the minimum first practice, if after 2 weeks they are able to meet all of the criteria, would be September 7th. Okay. So the first regular season football game based on this criteria for that team would be October the 2nd. Okay. So that puts the state series, if we have one, which we probably won't, but if we have one, not beginning until December the 18th. Okay. These are very documented dates. You can look at it if you want to for yourself. State finals being played January 15th at the earliest. That is if we don't take time off for Christmas. Okay. So all I'm saying is make sure we understand that you can't take one and not the other. If we accept this, football has to be moved. Okay. So then you have to start deciding what sports programs you're going to destroy when you take and move football on top of basketball or on top of baseball, because something is going to be destroyed, especially in schools that don't have enough kids to go around. So I'm just pointing that out. As a board, we need to make sure we understand you cannot make this decision without moving football season and volleyball season. Okay. And if you're fine with that, that's great. I just want to make sure we understand that. The second thing that, as far as the SMAC report, I'm going to use my county, only example I have. We have people that tested positive in March that are still listed as our positive cases. So there is, with this 5%, there's no point in there that those cases fall off of the positivity rate. Okay. So, if they did, the positivity rate would be very different. But, we're talking 3-4 months ago, those people are obviously not infected anymore, but yet they're still counting against everyone. And the ones that have been found to be false. We had about a dozen in our county that were tainted and were false, but were not removed from the health department records. Okay. And I could document that if needed be. So those are the things that concern me with these numbers. And as Mr. Finlayson talked, we're way on the bottom end when it comes to, what we're asking. So also, one of the biggest complaints in the, hundreds of emails that I've gotten over the last couple of days was that we needed to move it later so everyone could start on the exact same date. Okay. So, and I understand that sentiment, but nothing in this proposal will ever allow us to start on the same date again, unless we completely move the season, and at that point, there's no guarantee that we can even start in the winter or the spring. But I want to point that out, that is one of the biggest complaints I heard, is that we're not uniform, and South Florida is getting mistreated because we're not uniform and we won't wait on them to start. The last thing is that I think that this is an opinion. This is not something to point out. This is just an opinion. It is a serious overreach on our part when we start telling each school district how they should deal with their student population. And this is unlike anything we've dealt with. So yes, we do govern school districts when it comes to athletics. We don't tell school districts how to determine whether their kids can come to school. We don't tell school districts how to determine whether their kids can participate in sports as long as they are eligible. So, you know, this would be no different than us telling a school district that if someone had some type of infectious and contagious disease, that they have to tell that person they can't come to school and they cannot participate in sports. So, you know, that's just my opinion. I think it's a serious overreach for us as an organization. You know, we're always worried about liability. We didn't want to vote for the Zachary Martin Act because we were concerned about the liability. But, you know, now we're going to reach out and tell school districts how they are supposed to deal with their local kids. And I just feel like it's, you know, it's an overreach on our part. Thank you very much.
Mr. Johns, if I could ask clarification, when you say overreach on how to deal with their kids, what reference to athletics are you stating that they could tell
By telling them they can't start practice when their school district has determined it is safe for them to do so.
I don't know if you're referring to that or the safety measures included in the document, such as the screening and the temperature checks.
No. That's part of our reopening plan. We have all of that. You know, I mean, we're going to have screening stations. Every kid's going to have temperatures checked. Every kid's got to be screened. I've got to document it every day in my class. I've got to document it every day at football practice. I mean, no, I have no problem whatsoever with the screening part of this. My problem is us telling school districts they cannot start when they believe it is safe to do so.
Thank you for clarifying. Mr. Schusterman?
With all due respect, two of the things that the FHSAA does control is starting dates and state series. So I believe that we would have the right to tell counties across the state when they can start. I also go back to the previous SMAC recommendations the other day, which many of them are based on CDC information and are recommended across the board. But the other thing I'd like to say is that the recommendations of SMAC, if we would have followed those and voted on a certain date, which I know I can't bring that up anymore, but we would be uniform, and they had already volunteered to meet and assess the situation so we could all be on the same page. I do see concerns with county by county, but the original SMAC recommendations would have given us a sound, reputable board to evaluate the situation in the state. Thank you.
Thank you. Mr. Johns?
Just a quick response. Yes, I do agree that we have, and part of our authority is to determine start dates under a normal circumstance. Absolutely. And when it is uniform and we're doing it based on a calendar, this is very different. We're telling school districts that you can't start because we don't believe you're safe enough to do so. So to me, there's a difference there, but that's me versus my clarification. So thank you.
Mr. Finlayson?
All right, so just to make sure I understand, the 5% that we're talking about is a positivity rate of tests given during a 7-day period. Is that a rough understanding, Ms. Patrica?
Dr. Maynard might be able to speak more directly to this, but I'm suggesting a 28-day rolling period, not a 7-day period.
Okay, so it would be the entire 28 days of having a 5% within that 28 days, having to display a 5% positivity rate.
Dr. Maynard, can you jump in?
Sure. So to address a couple things to Mr. Johns, just to clarify, the Department of Health website very clearly states in their metrics that they are only recording one test per person, so one positive test per person. So the thought of the negatives, I'm sorry, the persistent positives, that should not be an issue anymore. I can't speak to what they were doing before, but a part of the CDC recommendations, again, to switch from repeat testing until negative, that's no longer recommended because of just what you brought up with the persistent positives. So that should not drive the percentage anymore. So hopefully that helps clarify. As far as the rate, the 5% rate, the way that the DOH website posts it, it is out of a 7-day time frame. You can kind of look to see, there's a nice little graph there over 6 weeks to see where your positivity rate is going. And so I think that if you fall at that 5% rate kind of averaged over the 28 days, I think that that would be acceptable from a medical standpoint, as long as it is not crossing over kind of on the way out, as long as it's not on an upward trend on the way out. That would be my interpretation of the data. I think the SMAC has resources that if you'd like us to tap into some true experts in the area as far as epidemiology, I'm happy to do that to help clarify any other questions.
Well, my concern is if we're talking about a 5% positivity rate as our measurement for whether schools can begin practice, a number of areas are still only allowing testing for people who are displaying symptoms. If we're only testing people who are displaying symptoms, isn't it quite clear that the positivity rate should be above 5%? Again, we're talking about a measurement that is not going to be indicative of the population as a whole.
That's a very good point. So yes, if you're increasing the likelihood of a positive test, if you have a higher pre-test predictability ratio, then you are going to potentially have a higher rate of positives. But still within that, if the true infection rate is going down in the community, even those with symptoms should be testing negative. So that's how you're going to see the virus starting to go away. Other things cause symptoms like fevers, chills, cough, shortness of breath. So, if the virus is truly going away, the rate of positive should still go away, no matter if you're checking symptomatic people or not.
But in fairness, if you were testing only people without symptoms, then the positivity rate should be much better than that.
Yes.
So again, that's a measure that I'm concerned about, measuring that positivity rate based on number of tests.
So I would take that into consideration as well. The way it's written in our recommendations is a downward trend and the positivity rate. So, I think that we still need to see the overall downward trend of cases, and keeping into account that they're no longer going to be recording the repeat positives, and we're not going to be testing the repeat positives. But
that's not the motion we're discussing. The motion we're discussing is that it gets to a 5% level within each individual county over a 28-day period. So I appreciate your understanding of the different barriers out there, but that has no effect on this motion. The motion is concrete. And with this motion, another issue and concern I have is to say 2 to 3 weeks. We certainly can't pass a motion that has that much gray area in it. And I would say too that if there's again, please understand that I'm in favor of full local control, just so that nobody gets sidetracked on my stance. But if we're going to say that somebody is already in that range before July 27th, yet they're not allowed to practice on July 27th because they haven't opened school yet. I have concerns about that. Plus, even within our county, there's only 2 FHSAA member schools, and we have 2 different opening dates. So it's going to be an impossibility to make this, consistent even county by county. So I'll have other questions later. Thank you, Ms. Otero.
Thank you, sir.
Can I address just one more thing? I'm sorry.
Yes,
I
ma'am.
think just so everyone is aware, I think just our guidelines are on the conservative side because there is a significant risk as we are opening back up schools and opening up in our area. And if you look at our trends in the whole entire state of Florida, as we have opened up since beginning of May, that if we do not make these strict, and yes, they sound strict, if we do not make these guidelines for the individual districts to follow, what we as the SMAC took home from the last meeting is from the superintendents, they asked for barriers, I believe, or guardrails or boundaries. They were asking for our guidance. So we are providing this as guidance. Yes, the decision is still at their level, but I think it is very important to provide the medical guidance if there are not the committee, as Ms. Patrica mentioned, that they have that access. So we are here to help and to guide, and it is still up to the counties, and we hope that they will make as safe a decision as possible. I would be very fearful of going back to play if the percent positive in my area was over 5 to 10%, and that's why we're going at the 5 level.
Mr. Finlayson.
And again, I want to thank you very much for your guidance, and I respect and trust that guidance. But I want to affirm what you just said too, that it is guidance and the decision should be made at the superintendent level. And I certainly appreciate that aspect of what you were clarifying. So thank you.
Thank you, Mr. Dodd.
Yes, Dr. Maynard, thank you for the work of the SMAC committee and for putting together an excellent report with a lot of good information. I've had a chance to look through it more, as all the board members have. You did allude to the 21 days instead of 28 days. And I wasn't really clear on why exactly 28 days is, basically a month. So why not 21 days? I mean, if you have a community that's trending 21 days in a row below a 5% positive rate for all their population, why again is that not enough?
So again, the 28 days is to cover 2 full incubation periods to capture if there is viral shedding on that 14th day of someone's potential illness. And again, remember, 50% of people are asymptomatic or pre-symptomatic. So if a asymptomatic person is on day 14 of their quarantine and they feel like, I'm on day 14, I'm good, I'm going outside, they expose someone else, the clock starts all over again. So that 28-day period is to capture 2 full incubation periods in order to make sure that the spread is not continuing to go up. That's where the 28 days comes from.
But you did talk about the 21-day possibility, is that right?
I said that would be at the bare minimum because that's about an incubation period and a half. I would be very nervous on that end from a personal medical standpoint. I think the 28 days is solid. It's much more conservative, but it makes medical sense and it makes epidemiologic sense when you look at the numbers and the exposure and the incubation period.
Okay. And then the other thing is, in reference to the other sports, we've had a lot of emails and a lot of concerns over other sports. I think every one of them I've had, except for maybe golf, with the concerns of allowing like cross country and swimming. And, what was the SMAC's opinion? I mean, so you want to limit, or not limit, we want to address football and volleyball with these numbers, but yet, there is a lot of close contact with cross country and there are things that could be done differently. But what was the SMAC's opinion or discussion, I should say, on those sports?
So I'm glad you brought that up because there are different documents that classify risk. The U.S. Olympic Committee has a document that classifies risk. The NFHS has their document, and then the NCAA has their document. And out of those, the most recently published was the NCAA document. And so, take into account that from May, when the original NFHS document was produced and published into, at the end of July, so almost 2 full months had passed, volleyball had shifted from moderate risk to high risk. And the reason, that people, I did get a few emails about that too. The volleyball, the way you communicate in volleyball is very boisterous, loud. You have to communicate with your teammates. If you're going up for blocking, you might be in people's faces. A lot of it's an indoor environment. I think there are plenty of risk mitigation strategies you can do, but that and football were felt to be the highest risk because of the potential respiratory exchange. For cross country, you're right. In our document, we even put that they should do staggered starts and other risk mitigation possibilities. Same with swimming. I think that the key with any of these is to avoid the congregation, especially for, extended period, 15 minutes or more. So avoid congregation at the start or end of races. I saw in the document already, it's avoiding the cross team handshake and fist pumps and all of that. Unfortunately, a lot of that teamsmanship will have to be put on hold until we get better control of this virus. So I think of the other sports, we felt that there were enough risk mitigation activities that could be done, that they were safe enough, that it was still a risk, because like I said before, we cannot eliminate the risk, but it's a low enough risk that they could participate if they felt they were able to.
Mr. Johns?
Just a couple of statements. One, kind of piggyback off Mr. Finlayson. I mean, this does not become guidance any longer if we adopt this. This becomes policy. This is not. It is no longer guidance. It is a decision-making process. So, just so we're aware of that the guidance is great. I think the guidance is very valuable. I went over it with our principal today and discussed some of the things that we're doing from an opening standpoint. In some of the things that this document provided. So from a guidance standpoint, I think it's great, but it no longer becomes guidance once we adopt this and require schools to follow it. Another thing is we talked about the not retesting or not having the secondary positives and whatever, and how that's driving up numbers. When you take my county, we've tested about 2,000 people. Okay. So many of those being, those recurring positives or whatever, which, okay, let's say as of today, they're no longer doing that. I don't have the data, but I can't imagine how long it's going to take us to only testing that many people in an entire county, how long it's going to take us to where those double positives or triple, however you want to call them, whatever the word for that is, do not hurt us any longer. So yeah, they might not do it anymore, but they're still there. And, if one person tested positive 3 times, it was counted 3 times and it's still there. So it's going to take us a long time to overcome that in a county our size, only testing that many people. The other thing that is just so difficult for me, we had a school meeting today. We have 352 kids, 7 through 12 in our school. We have had less than 20. We had a deadline that they had to tell us if they were going to go distance learning. And now they can still change later, but as of the deadline, we had less than 20 kids in our school that were going to go distance learning, which means on August the 14th, we expect about 330 kids to show up on our campus, which we're encouraging that also. I mean, we're trying to get them on our campus for face-to-face learning. But yet, if we adopt this, I'm going to have to, we're going to have 330 kids out of our 350 on campus, and we're not going to be able to play sports. But we can go to school every day. We can stand in line with all of those kids at our lunch line. We can be in classrooms that you cannot social distance, but yet we cannot play sports, even though they're on campus already. So that's just something I struggle with tremendously, not just football, any sports altogether. Just one more reiteration, I don't know how long this discussion is going to go, but we just need to make sure we understand that if you're a basketball coach or you're a baseball coach, you better get ready, because kids are going to have to choose between your sport and ours. So thank you.
Mr. McLean?
Dr. Maynard, and Ms. Patrica, so really, we're not saying move 2 to 3 weeks like the motion says. We're saying we're going to move it 2 to 3 from the start of school. True?
That is what the motion said, sir.
Well, it said the motion was to move it back the start 2 to 3 weeks. But then this says you got to wait 2 to 3 weeks of after school starts. So what is the motion? Is it 2 to 3 weeks after school, or we're moving it back from the 27th to the 10th?
Just to clarify, I'm calling up the language. Delaying the start, A, first of all, this is A, delaying the start of football and volleyball until 2 to 3 weeks after brick and mortar schools are opened, and delaying the start of football and volleyball until a county has less than 5% positivity.
Okay. And then with Dr. Maynard, when do we reach the point where the other sports becomes unsafe for them? Just so everybody knows when we vote, you know, we've talked about golf and cross country and swimming and bowling. Where does it become the numbers are bad that those sports can't proceed?
I would probably have to say that I would defer that to if the schools are having to close, if the governments are having to shut things down and take a step back. I mean, throughout the shutdown that we had back in March, April timeframe, you know, most golf courses were open, and we were talking about that before. So, you know, I think, but you have to take into consider these are our students, and they are students before they are athletes. So I think if a school is shutting down, then that's time to stop the sports, obviously. So there's not an upper limit cutoff, but you know, that I think should be left up to the schools individually.
Thank you. Let's go to Mr. Gertis.
Sorry, I always got to remember to turn that mic back on. Thus far, all the discussion, or the bulk of it anyway, has been all about football. Dr. Maynard, I was wondering if you could explain why you think volleyball is an equal risk of danger as football.
I believe I mentioned some of that earlier, but I'm happy to reiterate. So the guidelines from the different associations from sports medicine regarding the risk stratification, volleyball is listed as a high risk in the NCAA document that was just released last week. And the reason we felt to include it in the higher risk range is because of the indoor environment, the need for them to kind of boisterously, loudly communicate with each other, which expels the respiratory droplets further, and the potential contact, and just the fact that they're using one ball and not necessarily sanitizing it between every play. So that and that in and of itself has kind of put it into a higher risk category. I understand that there are risk mitigation strategies happening in a very large tournament in Orlando, and that is great if they're able to do that. You know, certainly larger gyms with better ventilation would decrease the risks. Social distancing would decrease the risks. Playing it outdoors would even more decrease the risk. So, you know, I think taking all those factors into account of the sports, football and volleyball are the highest risk.
Thank you, and I'm sorry if I missed some of that earlier.
Okay.
We're trying to digest an awful lot here.
I understand.
But I really appreciate it.
No problem.
Superintendent Moore.
Thank you, Ms. Otero. I wanted to ask Ms. Patrica just for clarification. The 28-day period, would a school, with your motion, a school would have to be at 5% or less positivity for 28 days? Is that the motion, or am I misunderstanding that?
It's a 28-day rolling positivity rate. Dr. Maynard, I don't know how to explain it other than repeating it. I get it in my brain, but I can't. I'm not a doctor, so I can't. Can you explain it to him the way you explained it to me?
So, yeah, sure. The reason we picked the 28 days is for that double incubation period again. The way that the Department of Health reports it, there is a nice graph that you can follow, and you can look back from the end date on the graph 28 days prior and look to see have you remained below that 5%, as kind of that rolling average, if you will. I think if there's a slight uptick to 6% one week and then back down to 4%, if it's averaging 5%, I think that's the safest way to interpret that data.
So it would, Dr. Maynard, and again, thank you for your work, and I appreciate you you taking time to answer these questions as calmly, and I appreciate all that you're doing. But so there could be a 28-day period where it could spike to 7 or 8%, but then come below that, or would it have to stay at 5 or below for 28 days?
There really is not, I mean, this is all new guidance that we are providing. I think I would feel comfortable, and the SMAC can correct me, but I would feel comfortable with the 28-day average, as long as on that 28th day, you haven't spiked above that 5%. That would be concerning, that the trajectory is going up. So I know that's hard to predict, but that's why, again, I would reassess no matter what day is recommended to start. You continuously reassess. And if the trend is going upwards, I encourage the schools and the districts to, take the safest measure possible. And if that means shutting down for another couple weeks to see what happens, then, this virus is just incredibly unpredictable. The only thing that you can predict is that it's going to change on you. And, all the protocols we have in place get changed all the time as far as testing and releasing from isolation and everything. So, again, these are guidance. Our panel agreed on it. So I understand you're trying to get it nailed down, and I'm doing my best to do that for you.
Okay. And you mentioned earlier a couple of times about a range somewhere at 5 to 10%, and y'all chose the more conservative of 5%. But
there's, again, not really, there's no hard set data that says it has to be 5% from a national guideline. This is our guideline based on our research and the interpretation of the percent positivity data in the state of Florida. Also looking at what the World Health Organization recommended for opening up states was a less than 5% rate. And we were at that point when we opened up, and it quickly turned around as life happened and exposures happened. So, the 5 to 10% rate kind of shifts based on where we are in time with the guidelines. So that's why we chose the 5% to be conservative. Again, we're trying to make the safest decisions possible for the student athletes, their families, coaches, officials, and everything.
And did I understand you to say a while ago that our numbers are being driven, the recent numbers and higher rates are being driven by a younger population, teenagers, and
that is definitely correct. Yes, if you look at the Department of Health website, the 10 to 19 and the 20 to 24 age is the highest rates currently. Trying to pull that data up while we're chatting.
All right. Again, thank you for what you're doing for our organization. And I would like to just state that I, like Mr. Finlayson, I am a proponent of local control, and I think we need to be very careful as we move forward with this motion. Thank you.
Thank you. Mr. Schusterman, did you have your hand up?
Yes, ma'am. Just to put a little more information on, most people know where I stand in the aspect of what I believe safety is in a uniform manner. I read the NCA reports, and they talk about, and these are things we have to consider and take a look at, and across the board they need to, the effects of, they're warning their college athletic trainers and their college physicians about looking at athletes that have suffered from obesity, second level asthma, and are diabetic. It seems that this disease has an effect, that's an underlying condition that really seems to affect these, not just kids, but anybody in society. So it's something that we should be, our trainers, our people should be taking a look at that and should be aware of that situation. I don't know if you heard, but today there was a tragedy in Florida where a 9-year-old passed away and no underlying conditions. So this is something we all need to make sure that everyone, if this is going to go back to local control, I do think it's our responsibility to make sure that local control understands what this is all about. It's only 8 months old, and there's a lot we still don't know about it. And I know several coaches who got it, and the only thing they do is they've been on a field. Thank you.
Mr. Ochoa?
Yes, I wanted to ask Dr. Maynard because I heard her address some of the other sports, the other fall sports, the other 4 sports with reference to the data that's shown on the dashboard with the DOH. I took the liberty to multitask here while I'm listening and went on the website, and I have it up currently. And I see that the target range, as a matter of fact, is that 10% line. I was just going to ask the question what she thought about maybe using that target range to kind of guide what we do with the other sports in terms of shutting down, if need be, and what her thoughts were on that topic, because I didn't hear her give an exact number that might be used in reference to the other sports.
Just to clarify, you're asking about a percentage rate in order to pull back on the other sports?
Correct. When I'm looking at the data, the 28-day data that you talk about here, they have a target range date that goes right across that data graph that is below 10%. They basically set the bar at 10%.
Right.
So what I'm asking is basically, since you're saying 5% should you recommend as a norm for football and volleyball, what might be your recommendation in terms of the other sports that we have here in the fall? Bowling, cross country, golf, swimming in particular, because I know there have been a lot of questions with both cross country and swimming, you know, in reference to this and some of the issues that have been brought up. So I just wanted your guidance there.
I think, you know, the 10% is recommended by the World Health Organization for opening up, and that's what the bar is set on the graph there. So I think that is a very reasonable number to set as that standard. Again, going by, you know, the World Health Organization guidelines, you know, and the research that we did, you know, not many of those counties out there are actually hitting the 10% mark either. So, you know, I think that all this is doing is speaking to the fact that the disease, the virus is very real and very still active in our state. So I think as we talk about returning to sport, no matter what date is decided for the district, thinking that 5% means that no one will get infected is not the case either. So it's very real. And I think, you know, these numbers are numbers to set goals. And I think that's great that we can do that. But, you know, it also shouldn't give a false sense of security once you do get below that bar that everything will be okay. We still have to follow all the risk mitigation factors, the masking, the hand washing, and physical distancing.
So Dr. Maynard, if I could ask a question just to that, if we got to that 5%, we started and then the numbers spiked, does that mean we're stopping where we are until we get back to that 10%? I mean, 5%.
The cleanest, safest answer would be yes. I mean, it's indicating that the virus is very active in the community. I mean, that was, you know, kind of where a lot of the guidelines for the stay-at-home orders were, because you just can't, once it's out and gets out of control, it spreads incredibly fast, especially within households. So I think, again, that is probably up to the decision of the districts and even the governor if we get to a point where we have to pull back certain things that are open anyway. I mean, they've already stopped serving alcohol in bars because that was clearly one of the fire starters for the spike that happened recently. So, you know, measures might have to be taken if the trend goes up quickly.
Mr. Finlayson?
So again, I appreciate Dr. Maynard's guidance. And a lot of these questions, however, have nothing, absolutely nothing to do with the motion that we're discussing. The motion is that a school may start when their county gets to a 28-day average of 5%. That's the motion. And again, I want to, you know, it's just not to me, a reasonable way to proceed. So let me give you a hypothetical mathematical situation of this motion. So you could have 0% positivity for 21 days, and then 20% positivity for 7 days, and you would be able to start that day because you would be at that 5% mark. On the contrary, if you had 20% for 8 days and then 0% for 20 days, you would not be able to start. And then, according to this motion, once you start at that 20% for 7 consecutive days, it could spike to 60% positive. And we're able to start, we're able to continue participating. So I just don't think that, the motion that we're discussing is a reasonable way for us to proceed.
Mr. Johns?
I have a question for Dr. Maynard, because, and I'm going to talk out of stupidity, so I'm asking activity rates. Am I correct in assuming that if we test 2,000 people and 200 are positive, then we're at 10%? Is that correct?
Yes.
Okay. So across the board, that's the way that is done. So as the number we test goes up, then our percentages are easier to move rather than the lower number of tests is the way I'm looking at it. So I just want to make sure I was clear on that. I do want to say that I do not envy the position that you are in, because I think that, you're being asked a lot of questions today that maybe you don't, I don't want to say don't have the answer for, but it's not what you intended from this. And because I hear a lot of, your opinion would be such this and that, which I respect, but also that there's a lot of things that you say that, well, that would possibly be up to local control, or local people would decide that, or I would be comfortable with that. The concern is, I don't know how we pass. I mean, we may do it, but I don't know how we pass a motion on a proposal that fluctuates as much as it sounds like it does throughout this conversation. So that's a concern for me, obviously, as we move forward. Two things I want to point out. Just understand that we were cautioned at the very beginning of our last meeting not to compare high school sports to travel ball and AAU and those type of things. So I'm not going to do that. But it is reality that if we don't have volleyball in the fall, they are going to play volleyball every weekend, every chance they get. Now, football will not. Yeah, they will, because they'll continue 7-on-7. So, yes, I understand they're not exactly the same, and I'm not trying to compare them. But we are fooling ourselves if we don't think that is going to take place. And then also, when you start looking at the northern part of our state, which I know the only thing that seems to matter is the southern part, but when we start looking at the northern part of our state, do not be surprised if kids in Baker County decide to go play at Charlton County, which is about 20 miles across the state line. Don't be surprised if kids in Baker, Florida, don't cross the state line into Alabama and play. So you can be ready for that, because that's going to take place. Because when we pass this, that means football season is put on hold indefinitely. They're going to go play football somewhere. So we're going to lose kids that are going to leave our state and go to other states. Kids from Madison are going to go to Valdosta. I mean, it's going to happen. So just as long as we're aware of that. And I may be the only one that I would like to hear, we haven't really heard Mr. Tomlin in a long, long time. I would just like to hear, his thoughts on this, since, we did hire him to be the executive director. And I know this is a board decision, but I would like to hear what he has to say about it.
Mr. Tomlin, I'll turn it over to you.
Thank you. Don't turn it over to me, because you guys are on a roll here. No doubt about that. Thank you for the very, very healthy discussion. And it is an educational piece for all of us. And thank you again, Dr. Maynard, for being with us. I'm very concerned about how complicated this issue is, and how the terminology has been used, that it's ever changing, it's inconsistent. There are no clear measures. There's a clear measure today. There's no clear measure tomorrow. So again, with it being a very, very complicated issue, and in the essence of trying to be consistent with this, and also in recognizing what we have I believe as a state and individually recognize that local control and local decision making. I think that you're stepping a bit out of your range or out of our wheelhouse here. Were you to recommend that you consider this, or that counties and schools consider using this data as a helpful tool, that's very different than requiring to do that. The final thing I'll say, and I don't want this to end discussion by any chance, but at our last meeting, we addressed the SMAC considerations, and we addressed football and volleyball in the motion that was made and carried on, that we would create the opportunity for schools to begin play and practice on July 27th, but not require. And then we would work with schools who were not able to participate at the beginning of the season, so to speak, and only could pick up mid-season or something like that. And we would extend their opportunity to play throughout the state series if that team chose not to participate in the state series. There was also some discussion about even making that even a broader stroke and giving some authority to the association if a school district could not participate at all in the fall in one of these sports, to give them the opportunity to do something in a different season, perhaps in the wintertime. That was not part of the motion, but as you have read your agenda, that is one of the recommendations that I have intended to make. There's been no motion on the floor for that at this moment in time, and there may not be one at that time, but that's something we could consider. I just think this is very, very complicated right now. Again, I don't want this to end discussion, but I've heard a lot of good things in this. You guys have behaved yourselves, if that's the right word. I will say that, and I truly mean that, because you've been very respectful of each other. And I think that's very important for this board to portray to the many, many people who are listening to this dialogue tonight. And I thank you for that. That's all I have at this time, Mr. Jones.
Thank you, Ms. Patrica.
I just want to clarify that the word required is nowhere in the motion that I made. These are guidelines that we would expect districts to follow. So the word required is in there nowhere. I don't see how this steps on local control. I mean, you're turning these guidelines over to the districts and you're saying, make your decisions to open based on these guidelines. We're not saying you have to follow the guidelines in the same way that we strongly recommended ice tubs and heat bulb thermometers until it became law. We didn't require it because we couldn't police it. I know that we can't police this. I also know that every person that I talked to in an education setting on this issue begged me for guidance. They begged me for guidance. We desperately want guidance from the FHSAA. We desperately want, we have some superintendents on the board. We have some former superintendents on the board. It's a lot for schools to open right now. It's a lot, and sports is something extra, and they're turning to the FHSAA and saying, how do we do this safely? And we have this doctor who I spoke with, who there was no question she couldn't answer. And the one question she couldn't answer, she said, I can't answer that, but I will go to an epidemiologist who can answer it. It brings me absolutely no joy to sit in front of you and hear Mr. Johns say you're going to destroy somebody else's season in a different sport. I get it. There are no good answers here. There is no perfect scenario where we can conduct football safely in the state of Florida and still conduct every other season of sport in the state of Florida. We have to be agile. We have to make decisions that we've never had to make before, because we are in a circumstance that we have absolutely never been in before. And I will leave you with this question. What is the priority here? Is the priority football, or is the priority our student safety? For me, the priority is our student safety. And I cannot, I said it when I made the motion, I am loath to reject the advice and guidance of medical professionals who have taken the Hippocratic Oath. Those are my comments. Thank you.
Thank you. Mr. Dodd.
So, Dr. Maynard, the SMAC committee, I think you said in our last meeting, met for 2.5 hours to kind of come up with these recommendations. And I sit here as a school board member thinking about the direction that schools are seeking. And it makes me want to pause, but in some ways, not just for football and volleyball, but for all our sports. And it makes me want to ask if there's any benefit, or what you think of the benefit. You said earlier that these protocols are changing daily. I mean, there's a lot of changing information, and protocols are differing. Would it be advantageous for the SMAC committee to meet again and talk about the things that we've shared here and discuss the other sports, discuss, would that be advantageous? I mean, would it be a good thing for us to postpone all sports for a number of weeks until the SMAC committee can meet again? We have schools starting up. A lot of them are starting up later in the school year. And Ms. Patrica is right. I think the same thing I'm hearing. There's a lot going on with just getting school started. Would it be a beneficial thing for us to pause and postpone all sports until a later date in August, when the executive director and staff, as well as the SMAC committee, can have another meeting and another discussion, look at the new data, look at the protocols, look at all this confusion on the positive rate that is, I think there's merit to those questions about that not being the most valid data. So what is your thoughts about the SMAC committee? Would it be beneficial if you all had time to meet again and prepare, and to relook at this data?
So I appreciate that question. I mean, numbers, the percentages, and hopefully the overall coronavirus presence in our state in a matter of weeks may look very different. Hopefully in the downward trajectory, hopefully in a decreasing percent positive rate. We are not headed in that direction currently. But I think it is worth mentioning that as we've been on the meeting here, that I've gotten several notifications that the Republican National Convention has been canceled in Florida based on the coronavirus pandemic. So I think, if others are seeing it from outside, that Florida rates are in a dangerous zone for opening up sports, that's an aside. But to answer your question, we certainly can. I mean, the SMAC is ready to meet whenever to discuss this further. I don't know that our guidelines or our recommendations would change in the direction of safety, though. I mean, our goal is the utmost goal is the safety for the student athletes to return to school safely and then to return to sports. If I think a delay of all the sports would be reasonable. Do I think it has to be done? Not if all of those risk mitigation factors are put in place for the lower risk sports. The cleanest recommendation sure would be to delay them all, but we're also trying to allow those that are able to go back to play in a lower risk environment to be able to do so. So if the board here would recommend that the SMAC reconvene and look at the data in a few more weeks, I think the fresh data as we open up schools is going to be what would drive our recommendation for opening up sports. So that's where this 2 to 3 week delay after schools open came from in the first place. And that's what we said in our original document, is that we would delay until further notice, and that until further notice was not at all meant to cancel. The until further notice was in order to reevaluate the data as schools open up so that we can see if there's an uptick in infection rates, whether that's based on total number or percent positives.
Thank you, Dr. Maynard. Mr. Johns, go ahead.
Just want to point out something. I have, for a couple of years now, we've worked together. I have the utmost respect for Ms. Patrica. I respect her motion. I would respectfully disagree that if we the word required may not be in here, but if we say we are expecting our schools to do it, then the expectation is that they follow this protocol. Unless that's not the intent, if it's merely for informational purposes, then we need to specify that it's for informational purposes. But when we say we expect them to follow this protocol, you might as well say required, because if we expect it, we expect them to do it. The second thing is that, just another point. I mean, we're still talking about not allowing things because of concerns, and the Republican National Convention is now part of this, but yet we still are starting school. And school is still opening up, and people are now, some of them are moving it back, but it's still starting. They're not canceling it. So, there again, we're still saying that it's okay to go to school, but it's not okay to play sports. So, and that's going to continue to concern me. Thank you.
Mr. Finlayson.
Yeah, I want to follow up on what Mr. John said, because we've got to get some clarification. Ms. Patrica, could you read the beginning of your motion once again?
Yeah, if I can find it. I've got 9,000 windows open on my computer right now. Bear with me for a second, please. There it is. I move that the FHSAA Sports Medicine Advisory Committee recommendations regarding the delay of football and volleyball as detailed in their July 23, 2020 report be adopted as the official guidelines of the FHSAA, with the expectation that individual school districts will follow these guidelines for these sports effective immediately. These recommendations include, and then it goes on to A, B, and C.
Right. So I guess help me understand, but when it says guidelines and that they're expected to be followed, that certainly sounds like it's being required to me.
Well, I have a law degree, and so there's a big difference between a requirement and an expectation. And I was careful in the word that I chose, because I don't think that the FHSAA can require anything. We do not have the staff or the capability to follow through and make sure that districts are doing anything. So an expectation is not a requirement.
Okay.
It's simply an expectation.
And I don't have a law degree, and so I'm sure that's where my confusion is coming in. I think that's difficult it's a difficult distinction for us to make. So we just need to be clear on exactly what the goal of that is.
It's kind of like, it depends on what your definition of is, you know what I mean? Like, it's one of those kind of situations.
Thank you. Mr. Gertis, and then I'd like to share my comments. Go ahead, Mr. Gertis. There you go.
Like Ms. Patrica, I had several windows open. Sorry about that. I guess with those comments in mind, I'd like to ask Mr. Ireland his thoughts on that language.
I have to agree with Ms. Patrica, particularly since it was her motion. That's what she intended to do. Can y'all hear me? But you could add to that it's expected but not mandated, if you want to be more clear. That's up to the board as to what it wants to take as a motion.
Mr. Johns, Mr. Gertis, does that take care of that?
It does answer my question. If I could, I know you want to get to your comments. I guess I just will make a few comments at this point, because I've tried very, very hard to listen to this, and I'm not saying others aren't the same as this, but I came in 100% with an open mind to this. I did vote against the proposal that passed. And the reason I voted against it was because I kind of felt that August 12th was a consensus in the task force meeting. And it was a consensus of a lot of the people I talked to in my area. I have private schools from Southwest Florida up to the Tampa Bay area. So I have the private schools in Ms. Patrica's area. And it's very obvious to me in that area that they are hit pretty hard, because they definitely want to delay. But I think, I can't say everybody, because there's no such thing as everybody, but I think there was a real consensus that we missed out on last time. And I'm not trying to create a new motion here. I'm not. I'm just trying to explain where I'm at in my decision-making process. That August 12th, there really was a consensus. And in fact, Coach Johnson from the Panhandle was the one in the task force that made the motion for August 12th because he saw that there was a consensus for that. On the other hand, I am a big believer in local control. And I believe that whether it's on this front end making decisions or whether it's on the back end making decisions on how in the world are you going to play all these sports at the same time. And for the small schools, that's a real burden, a real burden. And I'm not talking about my school, so I'm not personal on that. But the 1A and 2A schools, it's a huge burden. So my point is, local control is going to have to make extremely difficult decisions on the front end or the back end. So with all that said, I think I would lean towards local control. Thank you for your time.
Thank you. Mr. Johns, I'd like to give some comments first. I too have tried to listen more than speak right now as we've heard Ms. Patrica's motion. I too obviously voted against the motion that was approved on Monday, and August 10th, actually, Mr. Gertis, was the date that the task force recommended. One reason that I would support that, along the lines of what Mr. Dodd has brought up and some other points that have been brought up, there are a lot of recommendations, even in the recommendations that the FHSAA proposed in the agenda item that we haven't even gotten to yet, for the such as the waiver, such as the questioning. We've got to give our schools time to get these things in order. And to start on Monday and say that these things need to be taking place, or it's recommended that these things be taking place, that does not give our schools a lot of time. If we delayed to August 10th, if we delayed to another date just to be able to start practicing, that at least gives me confidence as a board member representing this association that I am giving my schools the opportunity to get these safety measures in place. As I listened to Ms. Patrica's recommendation, or her motion rather, I think it's a step in the right direction for sure. I think it's a step that we need to seriously consider the ramifications of letting everyone potentially start on Monday and then make your determination county to county. What I don't agree with, and I may be the only one that says this, I am hesitant to give local control when we represent an entire state. And to say that this county can go now and this county can go now, and then in a month later, you all get to go. That's not representing a state. For those of us in elected positions, we are elected by a region of the state, a quarter of the state, but we serve to represent from the Panhandle to Key West and from the East Coast to the West Coast. So I believe our decisions need to be beneficial to those that everyone is represented. And as I said on Monday, we are not going to appease everyone, just like school boards are making decisions to reopen. They're going to be people unhappy. And to Ms. Patrica said it very well, we were bombarded with decisions that we're having to make in our own individual districts, that then to put sports on top of it, that's just another burden that these superintendents or headmasters are going to have to face. I believe that we do need to have state control when we dictate when we're going to start. I believe that in the recommendation that SMAC gave, it's very concrete. And as what's being presented to give counties the ability, or districts the ability, to start based on when their data says, scares me to death, because there's 16 of us that can't even keep track of how it is we're supposed to know when to start. Is it 28 days in a row? Where does this rolling 28 days start, end? I am completely lost in the interpretation of, if I had to make that decision, I would be very apprehensive to make that decision for my school or my district if it was the position that I was in. Who would monitor it if it was a state level? Not to give you something else, Dr. Maynard, but I think that's why we have a Sports Medicine Advisory Committee. That committee advises the FHSAA, our association, to say it is safe to do this. And there is a body of skilled professionals way beyond a school-based administrator or a district administrator who has an education degree, not a medical degree, to say, okay, it is safe for our state to proceed. Is it going to disrupt all sports? Absolutely. It is going to disrupt every single athlete and when they play their season. And that's the unfortunate part of this whole scenario, or this whole situation that we're in, but it's the reality that we're in. And sacrifices are going to have to be made, but I don't want the sacrifice of making the wrong decision causing a death, as opposed to the wrong decision causing a student who potentially played 2 sports and now is only going to play 1 sport. At least they're able to play that sport. I think we dictate the calendar, and we are able to state as a state, we are going to start on this date. I don't agree that that's overreach, but that's my personal opinion to feel that way. As delays occur and we continue to push back, if this rolling period, as SMAC would advise us on when, or every 2 to 3 weeks, I think was the requested update of when to start. As we got later, that's when we start looking at the possibility of state championships. And is it possible to have a state series starting in October? It may not be possible, but we don't have to make that decision right now, which is the beauty of this. We can make a decision whether or not to start as a whole, as one body, to guide the entire state in the right decision. There are schools, there are districts that are ready, but as a consensus, they are not. I asked Mr. Tomlin very late yesterday if it was possible to find out when school districts were starting fall sports, since it was known that now we can start on July 27th. He very respectfully said, and I completely understand, it was too late to try and get that information from across the state. That is absolutely correct. But I did ask colleagues that I know around the state to get feedback on when their districts are starting. And when you ask one person something, it creates a domino of information. So as of 1:30 this afternoon, I was able to obtain information of our 67 counties, and forgive me, independent schools, private schools, for not incorporating the data of private schools because it's much harder to get that information. But of our 67 public school district counties, 47 of them provided a response. Of the 47 counties that responded, they represented 396 public schools that are members of the FHSAA. Of the 396 public schools, 359 are not starting on July 27th. They have pushed back their start date because it's a local decision right now. They have pushed back their start date either to a definite date or indefinitely, and it's to be announced. 37 schools out of 396 are ready to go on Monday, July 27th, in 3 or 4 days from now. I don't think that's representative of a body, of an association that represents an entire state, to say that our teams should be ready to go or should be out there on July 27th. To Mr. Dodd's point, I feel wholeheartedly that we need to hit pause. Everything is fluid, as that's the term that is most popular right now after unprecedented. Everything is fluid, and to reevaluate in 2 to 3 weeks, okay, we can start those lesser contact sports. Where are we with our numbers? I am more comfortable with our lesser risk sports starting, but it is very difficult to manage. This sport is starting now, this sport is starting then, when is this sport starting? And then we talk about, even though they're lesser risk sports, the venues and the facilities are not there. We talked about bowling in South Florida and Central Florida. Our golf courses are open, but they're not open to our schools. Our pools are closing. So you're talking about 2/3 of the state now that it's not hard to socially distance in that sport, but it's hard to be able to play the sport if you can't get in that venue that sport requires. Those are my comments that I wanted to share. Mr. Johns had his hand up. I don't know what other discussion we have. I know we've belabored this, but I do think it's important. I'd love to hear from Mr. Oliva also, who has just indicated he'd like to speak. Mr. Johns, do you still have your hand up? Go ahead, sir.
Yeah, just 2 things. One, I wanted to clarify to Mr. Gertis, just for the record. I mean, it doesn't matter at this point. I had no problem with the August 10th start date. The only problem I had with August 10th was the ramifications that it was going to present as far as the season, and us not having an answer for that at that point. So I was never against August 10th. I was never against moving back. I just was against moving back without a definite plan of, are we cutting games? Are we pushing the season back? What are we doing? And as of Monday night, we did not have that plan. So that's why I left it with July the 27th. So I still need some clarity because I'm assuming we're fixing to vote on this. I still need some clarity. So and I'm not a lawyer by any means, as you can tell, but if it's not required and it's expected and my superintendent says we can start, can we start? I don't, to me, I don't understand. I mean, I know the difference between required and expected, but I don't know how we pass something or even vote on something that we don't know that answer to. So if it's expected and my superintendent says I can start Monday, then I can start Monday. If it's required, it doesn't matter what my superintendent says. So, I mean, and if I'm wrong, somebody please correct me, because when we get ready to vote, I don't understand the difference between it. Thank you.
Go ahead, Mr. Ireland.
I just reread the motion, and I don't know whether Mr. Patrick would be willing to or not, but if you change the word expected to hope or something of that nature, you may take all that problem out of it.
If I take the word what?
To change the word expectation so it would read as the official guidelines of the FHSAA with the hopes that individual schools would. Because it appears, I mean, it's your job, not mine, but it appears that this is here because people are looking for guidelines. And if you're giving them guidelines, then that's something that they can follow or they can't follow as they, in their wisdom, decide. But if it can be interpreted, although I agree with you legally, if it can be interpreted that it is not a mandate, then that creates problems, and we don't need that problem as long as we discuss this. That's the only thing I had to say. If that cleared anything up.
Mr. Oliva.
Thank you, Ms. Sotera, and thank you, Dr. Maynard, and everybody on the board, and Ms. Patrica for making a motion that's received lots of great dialogue and conversation around it. I could tell you from my perspective, I've always been one to support local decision making and let the experts in the communities drive the decisions that move their thinking and learning forward. But it's definitely evident, even after the actions that we took on Monday, that many districts, even if they were eligible based on what Ms. Sotero was just sharing, to start practice, they're just not quite ready to do so. And my thought process, when Mr. Dodd was speaking, I think we were sharing the same brain cell or the same wavelength. It's that SHAC has done a great job, or SMAC, excuse me, has done a great job putting together a report. But data has changed. The guidelines are changing. There's still an opportunity to provide clarity in this report. And I would be of the consensus or the standing that if we were to take action today, right now, to try to adopt and implement this plan, I think we can get a better plan if we just hit the pause button for a couple of weeks, let the experts have some more time. I believe we're getting new CDC guidelines as early as tomorrow on reopening schools. When we were moving forward, I can tell you that many districts had August 10th as the beginning of their calendar over the summer. And as recent as 4 weeks ago, I believe many of those districts were planning on still having school on August 10th. Well, as data and trend lines continue and we start making informed decisions, many, or if not most of those districts are pushing back a week or two. And it's part of a strategy to get better information, to get better training, to look at trends and make sure they understand their communities better. They're not just randomly pushing back dates, but they're being methodical. And I would be in support of saying, let's take a couple weeks, re-strategize, get some new data, get some new guidelines and some recommendations for local decision making to support the people that are asking for those parameters.
Thank you, Mr. Oliva. Ms. Patrica?
I think that's beautiful, Chancellor Oliva. My only question would be 2 weeks. Is that enough? Because I don't know that SMAC considerations are the only thing we need to look at here. I feel like our staff has been derailed a bit by, and this is no slam against the task force, but I think that they were derailed by having to conduct those meetings and digest everything that came out of them and try to come up with plans from that. If we delay 3 weeks or a month, then we say to staff, do your work. Come to it. Look at all sports in the state of Florida and come to us with a recommendation. I mean, that's how it works in my school district. The superintendent and his staff do the work and they come to us with recommendations that will work for the district. So I feel like this is an opportunity for us to give staff direction and say, hey, we need a good plan for all sports in the state of Florida, work closely with SMAC. And because there could very well be very many unintended consequences to whatever decision that we make today if staff isn't freed. And I mean, completely free them, let them do their work. They are incredibly capable. Let them do their work. And then we convene in 3 weeks or a month and we decide how comprehensively to approach sports in the state of Florida. Those are my comments, sorry.
Thank you, Ms. Patrica. Mr. Dodd?
Yes, so if the board decides to vote down the motion, I would like to make a motion in regards to pausing on all fall sports. And I have written a motion here as the meeting has gone on that I'd be willing to make.
Mr. McDaniel?
I would also like to add that I want to echo what the last three speakers have said exactly. And we need to engage all of the task force, all the advisory boards that are duly elected and appointed all across the state at the various levels. We haven't engaged them. And I think your task force that was formed would be a perfect venue for those groups to give feedback. So along with SMAC, all the other groups, this can happen in a quick fashion. This doesn't have to take 2 months. It can take a few days, engage folks, get feedback, and let the staff build a plan that our board can vote on. We can't make policy from scratch with 4,000 people watching us on Zoom. That's not the way you build policy. You let professionals bring it to the board and we can chew it to pieces and edit it and argue and stuff. We can't make policy from scratch. That's not what we're tasked with, in my opinion. Our board is to approve policy, but not write policy in front of 4,000 people on a Zoom meeting, for goodness sake. So we need our task force and our staff who are experts at that to bring us policies. I appreciate all the comments, but I think that's what we should do.
Thank you. Mr. Schusterman?
I want to applaud the last 5-6 minutes of conversation. It has been incredible. It's an honor to, this group is really, it's really something to hear what has just transpired. I think we have a great staff at the FHSAA. They can put together some things. If we wait a couple of weeks, we'll have even longer, as Ms. Patrica says, we'll have an honest, good interpretation of the numbers that are out there, and we can put our kids safely on the field. And I think it's something we all have to look at, that we owe to every athlete, coach, parent in the state. And Ms. Otero, I thank you for starting this conversation that just took place. But
Madam President, I think we're getting a little far afield of the motion, so I will remove my motion from the table if I can have a second so we can move on to the next discussion.
Mr. Schusterman has seconded that. Thank you, Ms. Patrica.
Yes.
Mr. Dodd?
Well, can I ask one question first?
Sure, go ahead.
Okay. Chancellor Oliva, what is, from your knowledge, what is the average first date of school going across the state? What is the area of August that most people are starting?
So great question. I would say 4 weeks ago, August 10th, statutorily is the earliest that schools can start. It's in statute that you can't start before August 10th. And most school districts want to start early because they want to have as much time to prepare students for end of year assessments and all those components. I would say right now, August 24th, around there is probably the most popular. I don't have the empirical data in front of me. We have it. I just don't have it in front of me.
Yeah, no,
But
I
if
got
I was
it.
to make a guess, I would say probably about August 24th is consistent.
Thank you, Ms. Otero.
Thank you. Mr. Tomlin.
Thank you, and thank you, Chancellor Oliva. I do have some information that I received from the Florida Association of District School Superintendents. I received 2 different charts, and then in the course of an hour and a half, the data had changed. But I can share with you as of the end of the day, when I received my last email about 4:30 from Joy Frank, the attorney for the FADS group, that as I believe I counted them, and it's 5 o'clock and I wasn't counting real well, but there were still about 19 districts that are starting on the 10th. There were 15 or 16 that were on the 17th. There were 22 that were on the 24th. There were 9 that were on the 31st. And there were some that were waffling, and there were some that had just separate comments, like, for instance, Dade County had a date down there, but we also know that I don't know what that means when they start, or they're starting in person or virtual. And that piece of information was not on here, what kind of opening there is. So it's across the board in 4 different weeks, in the 10th, 17th, 24th, and 31st. The 24th has a couple more than the others, but it's really across the board right now. That's the latest data. Mrs. Frank assured me that that was going to be changing by tomorrow morning.
Thank you. Ms. Patrica.
You can make that 10, Mr. Tomlin, that are starting on the 31st, because my board voted earlier today to move to the 31st. So not that that matters, but can I ask you, Mr. Tomlin, before the next motion is made, in your estimation or in staff's estimation, how long would it take for you to get with our advisory committees and take a really comprehensive look at all sports and come back to us with good recommendations on how to proceed?
We have 6 different sport advisory committees. We have the Sports Medicine Advisory Committee, and it would probably be advantageous to also include the Athletic Directors Advisory Committee. So there are 8 different groups that are working. I know that there are many of those employees in our school districts who have returned to work, but there are probably a lot of people who are still on vacation at this time. Our staff has been consistently working remotely the last month, 4.5 months, almost 5 months now. So we are capable and well-versed at using virtual meetings and Zoom meetings. We would be able to convene, I believe, some of our groups. And I see that Mr. Harrison has clicked on an audio. So perhaps, and I know our staff is watching this tonight. Also, we have our Officials Association Advisory Committee. We've got about, I'm going to say 8 or 10 different committees at least that we could involve in this process. Now, I'm not going to gather 80 people on one Zoom conference. We would meet individually and we would talk individually about what there is. I would need, I think, and I appreciate the opportunity to do this, because this is what we've been saying all along, that we would like to pause and give us an opportunity to gather some information. We would like to continue to have our schools that can continue to begin the fall season to go ahead and continue their fall season as we have given them the opportunity as a board. But okay, Mr. Harrison, I'll be quiet right now and let you chime in here, because Mr. Harrison does coordinate all of our advisory committees.
I believe we could get all that stuff done in a matter of 2 to 3 weeks tops.
Thank you, sir. So I'm not sure what the marching orders are, other than to appreciate the fact that you have confidence in our staff to work on something. I gather that what you've asked us to do is to get some further recommendations from those various advisory committees in combination with SMAC, in combination with officials, and going forward. And are you looking for us to come up with a calendar, perhaps an additional calendar? I just need some clarification. I appreciate the challenge, and I'll swear to you our staff is up to it, but I need some clarification on what those expectations are. And each one of those staff members has a pen and paper in their hand right now.
I would think that clarification would come, Mr. Tomlin, after a motion is made. I just wanted a time frame for whoever's going to make the motion.
Yes, ma'am.
I agree with Ms. Patrica. So I will refer to Mr. Dodd now. I do believe he has a motion to present.
Yes, I have a motion that does have some dates in it. Obviously, we can amend the motion, but this is going to be my motion. I would like to make a motion to temporarily postpone the start of all fall sports until August 24th, allowing summer conditioning to continue until that time, and directing the executive director to work with the Sports Medicine Advisory Committee and other advisory boards to prepare a recommendation for the start of fall sports at an August 17th in-person meeting of the board of directors. I can read it to you again. I had been making some notes, but I like to say we're temporarily postponing because that's what we are. We're taking time. We're hitting the pause button until August 24th. We would allow the summer conditioning to continue until that time, and we would direct the executive director to work with the Sports Medicine Advisory Committee and other advisory boards to prepare a recommendation for the start of fall sports at an August 17th in-person meeting of the board of directors.
Ms. Patrica? Ms. Patrica has seconded that. Thank you to both of you. Discussion, please. Mr. Ireland, let's, I guess you have a comment to refer to that.
I do have a comment. The only concern I have with that motion is the in-person, because Alachua County is pretty tight as far as the ramifications for meetings of that nature. So it would be, it'd have to be subject to Alachua County regulations that we have to abide by here.
Or we could find another location for the meeting.
I just want to bring it up to you. Thank you.
Thank you. Mr. Tomlin?
Thank you, President Otero, and thank you, Mr. Ireland, for those comments. Depending on what Alachua County's regulations are at that time, currently Alachua County does have the maximum number of persons in one particular gathering room at 50. I'm not sure exactly the size of that room, but that's the number right now. We could do a couple of different things and we would have to get together as a staff. We could socially distance our board within our conference room, but it might even be more advantageous to go to a local venue that we have rented or leased before and ask for that opportunity. At this moment in time, I cannot guarantee that we can get the 17th for that date, though. I certainly concur with the in-person meeting, because that is very, very good. And I know the challenges with that, with people traveling, and we would have to have some kind of combination of those who could not travel to be able to participate either virtually or something like that. But we can certainly do that. I'm not really interested in determining a date specific that we're going to meet, but within a 3-week period of time, we can certainly do that.
Thank you, Mr. Tomlin. Thank you for that motion, Mr. Dodd. Mr. Oliva?
Thank you, Ms. Otero. May I ask Mr. Dodd a clarification?
Yes.
I just wanted to make sure I understood. The motion is to have a meeting to review staff recommendations before the August 24th date, but then is this motion to say that these sports can start practice on August 24th, or we're meeting on August 27th, or excuse me, August 17th to discuss the start of the 24th? I just want to clarify. I'm sorry.
That's what I am saying. I mean, we would be waiting until all the new information is before us on August 17th, which would be a week before, obviously, the 24th. Now, if the board feels like we should move that sooner, and if the executive director could get the information prior to that, I'm all for that. But I want to have at least a week's notice that we could give to our schools when we see the new data, when we see the trends. Hopefully the SMAC committee is going to get together again and talk about all these issues too. And I have faith in Mr. Tomlin and his staff. I mean, that we can get, we'll have a much better picture and idea of how to go forward.
Just one clarification. Thank you.
Mr. McLean?
Yeah, Mr. Dodd, I like I think it's a great motion, but are you saying again that schools cannot start till the 24th? And then on the 17th, we'll let you know. So do schools plan on starting on the 24th, or do they say we can't start before the 24th? You know, just so everybody kind of knows. And then on the 17th, we're going to tell them plan on the 24th unless you hear otherwise, or we'll let you know on the 17th if you can start. You know, I think there's a difference there.
Well, we're postponing until the 24th, so no teams can practice or try out until the 24th. But at a date prior to that, Mr. Tomlin, and through meeting with the advisory boards, will bring a recommendation to the board for either the start on the 24th or further out into a calendar as to when schools can start.
Okay. So in your proposal, I mean, in your motion, it also includes that they're like, for example, in, I'll just say volleyball, they're going to bring us a couple of plans. If we start on the 24th, here's a plan. If we start on September 10th, here's a plan. If we have to move, heaven forbid, if we have to move it to spring semester, here's the plan. Or are they just going to bring us a plan? A couple different plans for each sport, depending on, you know, and then we can vote on, you know, moving sports, delaying sports, you know.
Well, that would be the information that Mr. Tomlin would, you know, prepare for us.
Okay. I think it's a good motion.
Ms. Patrica.
I would just beg some flexibility with regard to the meeting date so that staff can determine what works best for the board and what works best in terms of venues. Because I know I can't make the 17th and I don't want to miss any meetings with all of you because I love you all so much.
Thank you, Ms. Patrica. Mr. Tomlin, I will, as the board president, I will offer Tampa as a location if Alachua County cannot. Just so you have that as a reference as you look into those options. To Ms. Patrica's point, I do think we need a couple dates, just like we have presented the last couple times. When we have called special board meetings, usually we've been given 3 dates or 2 dates for 3 different times, et cetera. So to Mr. Dodd, at the point that it's appropriate, if you would consider amending your motion to allow flexibility within that 3rd week of August,
yes,
to be able to establish a meeting date.
Okay, I would say, yeah, I don't have a problem with that at all. I mean, August 24th, I think we got to stick to because that's what we're temporarily postponing till. But as far as the second date, I could, I mean, again, I think it should be at least a week prior to. So can you, or can someone give me an idea on Mr. Tomlin how to amend that to meet your needs?
No. Let me see if I understand.
Dr. Maynard has a recommendation.
I think you'd like to amend your motion to the effect to give us an open window to meet as soon as possible. Is that good enough? As soon as possible in the next 2 to 3 weeks. Ms. Rohr, help me with the question there. She's my communication expert and I rely on her, especially after 7 o'clock.
So, Mr. Dodd, I think, so your original motion was to postpone all fall sports until August 24th, with summer being continued through that time. And then work with all advisory committees and FHSAA staff present a proposal. And you said at an in-person meeting on August 17th, but that last part could be amended to say at an in-person meeting the week of August 17th.
Yes, I mean, again, I want to have at least, we have to give schools at least a week's notice. So
by the 17th, I think would be appropriate.
Yes, prior to the 17th is what I'm trying to say. I don't want to meet the week of the 17th and have it be towards the end of the week. I mean, I want to have at least a week's notice for schools from that recommendation that we'll be hearing.
Dr. Maynard?
I just wanted to comment from the SMAC's position, if we are going to have the, updated data, yes, we will have another 3 to 4 weeks of data under our belt as far as the numbers and the trends. If we have the meeting prior to the start of the majority of schools, we will not see any data regarding any school exposures. So just, I'm not going to argue the date necessarily, but I think the closer to the 24th, as far as providing that information. I know there was some comment that our report didn't have time to be digested, but I would be hesitant to turn in a report for the board to review that the data could be not necessarily up to date as far as any sort of school exposure. So if we do decide on a date, how soon prior to that date would you expect the SMAC's report to be in, I guess is my question. The closer to the date of the meeting, the better for that most accurate data.
Okay, so I could amend my motion to say that it will be at an in-person meeting between August 10th and 17th. I mean, we could put it that way. We could put a window for when we'll have the meeting between August 10th and August 17th as an in-person meeting of the board of directors. How does that sound?
That gives us a window period, and that gives us the 15th, 16th, 17th, and certainly we're getting closer to something that we can put together without any problem.
Thank you. Mr. Johns?
My question is just for Mr. Dodd. As many people have pointed out this week, I'm just a football coach, so I'm really struggling with. I understand the 17th. That's pretty clear. The 24th, in your mind, you're using that date as a target date to start athletics, provided that on the 17th, the information allows that. Is that what you're saying?
Yes, that is pretty much what I'm saying, that we'll have another month's worth of data to be able to, or maybe not a month, but 3 weeks worth of data that we'll be able to see.
Okay, so when coaches ask, the 100 that have already texted me today, and my players and everybody else's players and parents and that kind of stuff, I can't tell them the 24th. All I can tell them is we're meeting again on the 17th, and if everything's good, we would start the next week. Is that, am I accurate? I mean, that's to me, that's the only way I can look at it, is because it may change on the 17th. We may come in on the 17th and say we can't play at all. So, I guess what I'm saying is I don't understand the 24th other than you just telling me that's a target date.
If I could speak to that, Mr. Dodd, and you certainly made the motion, but if I could try and clarify as the chair, and you certainly, if I speak inappropriately or incorrectly rather, please speak up. I know a lot of districts have created phased approaches to their summer conditioning, and they're looking at 2 weeks at a time. So as they get closer to that next phase, they reevaluate and they determine we're going to stay in this position or we're going to go to the following phase. I think that's what Mr. Dodd is presenting. We are setting a target date of entering phase 1, which is to return to fall sports as we know it on August 21st. I'm sorry, August 24th. That decision will be evaluated for final decision-making purposes on August 17th. On August 17th, it could be determined that based on the data that SMAC provides and the other the other advisory committee provides, no, based on the current circumstances, we need to delay further. And at that time, Mr. Dodd or someone else would make a motion. This is our next target date. So to Mr. Johns, any coaches that would ask, that is the target date to be evaluated on August 17th to make that, or by August 17th to make that determination.
Yes, I agree. That's pretty much, we've said the target date right now is July 27th, right? Next Monday. So this would be a temporary postponement until August the 24th. But what Ms. Otero said is along my lines of thinking also, yes.
Okay, so my understanding is then that all of the coaches that have already been through that phased reopening, who have had full team practices for a month now, who are starting school on the 10th or the 20th or the 17th or whatever, they're basically being put on hold as we continue to wait longer to make any decisions, correct?
Speaking for Mr. Dodd as the chair, I would say that is correct. And if I could say it further, I believe that's what's best for the entire state, as it's, I believe, our obligation to look at.
Well, and I will respectfully disagree, but that's between, my understanding and yours.
Absolutely. Mr. McDaniel.
I wanted to circle back to Dr. Maynard. And again, thank you for the data. It's incredibly comprehensive. One of the things you said that your last comment was about the school data. So as we go into these various phases, what kind of school data would you be, as a SMAC member of the SMAC, would you be wanting schools and this association to look at and consider if they're rolling open 17th to the 24th? So let's say that you give us a new report early in September. What should we, as this association and individual schools, be doing with that data?
So I think what we would do is our most objective reportable data is through the Florida Department of Health. So in that dashboard, they have it broken down by age ranges, like I mentioned. And so I think, the schools don't necessarily have to report that. I don't believe, but I would still rely on the Department of Health website in order to look at the trend of the percent positives in the school age range and overall trends as well. If we continue to see the rates within that 15 to 24 and 24 to 30 range spiking, mainly, of course, the high school age, then I think that's cause for concern. Now, if remember what I said before, also just a reminder, when the data hits, that exposure was probably about a week prior. So our data is going to be delayed. So I absolutely appreciate, and I'm not a voting member of this board, but I appreciate the pause button because I follow science, I follow medicine, I follow data. And so if we are able to see how the trends are going to be once we reopen schools, we will have potentially by, if 19 are opening August 10th, that week, we will not have any data from any exposures during that August 10th week. So I am a little concerned with the dates that are put forth only because I don't think from a medical standpoint, we'll have the data that everyone's hoping to see. We might be able to come back with different or better explained benchmarks, if you will, and we can certainly provide that with some clarity. But I don't know that we will have the data that will give me the confidence to recommend opening sports at that time.
Well, that's exactly why I asked, because I'm afraid we're going to be sitting at the meeting and you're going to say what you just said. And I'm not sure that that's going to be very informative for us if we don't have the data that you think is critical for this board to consider.
Good point.
So Mr. McDaniel, just to go off that, are you suggesting that we go into September, we temporarily postpone until September where we can get better information?
No, what I was trying to get at was I was concerned that we wouldn't have a clear understanding of what the SMAC's recommendation was and might be at that point. It is going to be lagging data. And I think once school opens statewide, then the data will change. And so I was just trying to get a window into what that committee might report. And I think we just heard it. And I think we'll also be able to, I think they used the phrase rolling data or phases, maybe both terms apply here. I think this isn't going to be done. I think regardless of what decision we make on the 24th, I think we're going to continue, or 17th, we're going to continue to need to monitor this and make decisions. Someone used the word fluid earlier. I think this is going to continue to be fluid.
Mr. Curtis.
I have a hypothetical question, but just a point to be made on that comment there. I completely understand and agree with what you're saying, Dr. McDaniel. And Mr. Dodd, just my own opinion, I think the further back we push this, the less support it's going to have. That's just my personal opinion. But my hypothetical question is let's say we decide at some point that August 24th is the date. Should we assume the normal 2-week window before we have a competition?
If I could speak to that, I believe that's the FHSAA's staff that would come up in their plan that is presented on the 17th as to what would be best. That's who I would refer to for guidance as a calendar with a potential start date of August 24th. Mr. Schusterman.
First off, I believe the staff at the FHSAA is incredibly capable. There are plans being put out there all over the country. And when I was talking the other night, I was not talking about canceling sports. I was talking about adjusting the calendar. There are states right now that are looking at November. They've got flexibility to November. If you really look at the calendar for California, they're hoping to start in December with some other opportunities if things get better quicker or if things get worse. So I think that right now, if we meet on that date, we can talk about the flexibility of these numbers do spike. We're going to move to here. We're always going to have the option and the hope of having a real season. They might be shorter, but every sport can get the season. It's being shown all over the country right now. There are plans that are doing that. So there is opportunity. I think one of the things we can do, and if we don't do it, one of the things we can do is discuss some of those plans that a very good FHSAA staff will put together, and we can be prepared for any scenario that comes about. So.
Thank you, Mr. Finlayson.
Yeah, I have several things. First of all, I certainly trust and respect our staff a great deal and will appreciate their efforts to develop a plan. But again, if we're sincere with all of those comments, I believe that Mr. Tomlin's recommendation is to allow schools to start practice on July 27th. And that is the plan that they would encourage us to follow at this time. Mr. Tomlin, do you mind confirming that?
I would attempt to confirm that, Mr. Finlayson, because I had a question that kind of goes along with this. Board has already approved the start date for the opportunity to begin fall sports on July 27th and made it a local decision that the school and the district makes that decision whether start or not start.
Okay.
For if I could, for practical people who are listening to this, if this motion passes, I'm asking for the interpretation because people they're not worried about our staff and when they meet and how many advisory committees we have and what the calendar looks like. They want to know if this motion passes, what this does is that changes the start date for fall sports. It postpones that start date till at least August the 24th and continues the existing summer policy. Beside all the other issues, which staff can work out, that's what you're really voting on, to change what you voted on Monday and to postpone fall sports until the 24th. And I'm asking for clarity. And Mr. Finlayson, perhaps your understanding is the same as mine.
Yes, it is. And I believe it's a motion that's contrary to what we just passed. And the motion did not come from a prevailing member of the previous vote. But anyway, so I'd look to Mr. Ireland at some point to clarify that. Along with that, again, if we trust the staff's opinion, then I believe that we should allow schools who are able to start on the 27th. I want to make sure everybody understands that all of us are concerned about student safety and student health and well-being. We are working with medical professionals in every area of the state that know their areas the best. And so I want to make sure that everybody understands that, as well as everybody wants the best for our student athletes in terms of an athletic experience. So we all have differing opinions of how to combine all of that. But again, I don't know who we don't trust at the local level to make those decisions. I have complete trust in our local people, both in the education and the healthcare community, to make those decisions about whether it is a reasonable thing to do to start on July 27th or not. And I don't think we should stand in the way of any schools from being able to do that. The other thing that we're losing sight of, I understand the plight of South Florida. But right now we've got schools predominantly in North Florida who have a window where they could compete. And what we're looking at is the window in North Florida may be August and September. The window in Central Florida may be October and November. And the window in South Florida may be November and December. But if we go in this direction, some schools may lose the window. The only window that they have may be gone from them. And that's very concerning to me. So I'll pause there and let Mr. Ireland respond to my other question, and then I may have more later if that's okay, Ms. Otero.
Yes, sir. Mr. Ireland.
I don't know how Mr. Dodd voted on the last motion. I'm not too sure that this motion is a reconsideration, although it sounds like it. I think the first question's got to be, is this, and the chair can rule on this, is this a motion to reconsider the decision that was made Monday? If that be the case, then we need to know how Mr. Dodd voted on the motion on Monday that passed.
Well, I voted on the motion. I was in the majority of the motion that passed on Monday.
Then even if it is a motion for reconsideration, he's okay.
And so I apologize, Mr. Dodd. I don't remember everybody's vote. I just like to clarify we're always trying to follow proper procedure. And with that also, I do appreciate, Mr. Dodd, the desire to give everyone a week's notice. I feel like that's what we did do on Monday. I feel like if this motion goes forth, that is not what we're doing today. So I have concerns about that as well. I don't know what difference 72 hours has made. We had lots of wonderful discussion as we continue to do. But I feel like we made a sound decision, and I feel like that we should stand by it.
Thank you. Mr. Johns?
I have a question and a comment. I'll start with the question. And it's kind of the reason I'm asking this is it's something I've thought about, but it piggybacks off of Mr. Finlayson a little bit. And it's outside of policy. So, it's just a thought process, but, we have a group of schools, as Mr. Finlayson referred to. I have a 10-game schedule. I checked with all 10 teams on my schedule. All 10 teams we're planning on starting on Monday, or all of the ones that we're playing against are planning on starting on Monday. So we have a window I could play a full schedule. There are many of us in this area that could play a full schedule, barring issues. Now, this is barring shutdowns, barring issues coming down the road. But there are many of us, not just me. Everything seems to be centered around just my school, but it's not. There are many of us that could play a schedule now. I would be requesting somewhere along the lines here that there be some ability, whether it be an executive director's exception, whether it be brought up amongst this board in this discussion. I'm not sure how to proceed on that, but to allow those of us that can play a season now with local approval from our superintendents to be able to play that season. We'll withdraw from state series, don't care about state series, a chance for our kids to play because our window is now. And rather than pushing it back to spring, rather than not playing at all, and I don't know if that's even possible, but, my comment to piggyback off that is several times I've been admonished for not thinking about what is best for the entire state. And by not taking that into consideration, this board is not taking into consideration what is best for the entire state. Maybe for the most number of places and most number of students and most number of schools, but not the entire state, because it does not equate to what is in the best interest of everyone along the I-10 corridor
that is able to participate at this point. So if that's what y'all decide, that's what we've got to live with. But I've spoken to enough schools that would be willing to withdraw from state series and go independent and forget about state championships if we're allowed to go play football or volleyball or whatever it might be. But there again, that is not within the parameters of what we're allowed to do. But, if you really want to do what's best for the state, some consideration should be given to that.
Thank you. Any other comments? Mr. Gertis?
I have one.
Can I ask you, hold on a second. Mr. Thomas, I don't know if you're raising your hand to speak.
Yes.
Oh, I'm sorry. I'm very sorry because I just
go ahead.
caught that the second time. Yes, Mr. Thomas, please go.
Certainly, I do respect the recommendation from the SPI. I certainly recommend that we do everything that we possibly can to make sure that our students are safe. But I have a question concerning coaches that have already started some of their volunteer workouts. I think I heard earlier that all these coaches will have to place their programs on hold. And I wanted to know, what do you do if there is a district or a coach that decides to go ahead and continue their workouts, yet they have been placed on hold? How would we regulate that?
I would refer to Mr. Damon for that.
Thank you, Ms. Lachoa. Based on the motion, summer activities would still be in consideration. So the workouts that they're doing at this point in time, because fall sports have not started, will be the workouts that they would continue doing if the motion passes to extend summer to August 24th.
Does that answer your question, Mr. Thomas?
Well, it answered my question, but I'm not sure if it answered all of the question. So would someone still give me a little more clarity on it?
For teams that have practiced out of season or done things according to that violate our policies, there are sanctions that include fines, could be loss of practice time that could be rendered against a school.
Okay.
That answers the other part.
Okay.
Thank you. Mr. Gertis.
Thank you. I had one more question for Dr. Maynard. Are you aware of any data on any summer camps of kids high school age or overnight camps? Is there any data out there on that?
I am not aware of any specific examples of that. I know that the summer camps all had guidelines, CDC guidelines as well, to focus on the smaller camp sizes, the social distancing, all of the same standards. I believe there was a report out of Israel, I think, yesterday, showing a pretty decent spike after school reopening. So we hope that that we don't see something like that. You know, we're all really hoping for schools to open safely, but I think that's what we want to be able to witness before, you know, going any further. I know I spoke with our local athletic director who they have a wonderful phased opening plan. And, you know, we talked about how 1,200 athletes were following the phases with the, you know, the smaller groups, the outdoors only, then some indoors. We talked about masking the weight rooms. We talked about all sorts of risk mitigation. That's 1,200 athletes versus 123,000 students in the county. So, you know, the risk goes up once you increase the number of exposures. So I think that's why we want to wait and see what the data shows.
Thank you. I fully understand the importance of waiting on that. Thank you.
Mm-hmm.
Ms. Patrica?
I appreciate Mr. Tomlin's comments, but my concern with sticking with a July 27th date is that we have provided no guidance. We have provided no guidance to those schools as to how to safely return to sport. And I believe the purpose of this is to get that guidance, looking at all sports comprehensively. And I would hope that as staff looks at this, no option is off the table. We've seen a lot of really creative solutions across the state We've seen, I want to say there are 5 states that have moved high-risk contact sports off to the spring, and their positivity rates are in the single ranges. Florida, I think, is around 14.87% last time I looked. So, you know, the safety has to be really, for me, really has to be the key to everything that comes our way at our next meeting. Those are my comments. Thank you. Oh, wait a minute. And also, Mr. Johns, you're not just a football coach. Football coaches are like the oil that keeps our schools running. If it wasn't for you guys, a lot of our at-risk kids would never go to school. So please don't ever say that. Thank you.
Thank you, Ms. Patrica. Mr. Tomlin?
Thank you, Ms. Patrica, for those comments. However, I beg to differ with you. We have sent a great deal of information to our schools for considerations on how to create the programs. And obviously, they have already taken that advice because throughout their summer policy programs, they've already adopted many of the things that the CDC has suggested that we have forwarded to them, that the NFHS has created that we have forwarded to them, that our own SMAC committee has created that we have forwarded to them. So we have given our school districts a great deal of guidance. We've told them how they can successfully do things. We have not told them they cannot do anything. And we have certainly relied upon the local decision makers in that particular community. There's a combination of school personnel, health personnel, and whatever, and governmental personnel to be the guiding factors in local determination on what goes forward. So we have given everybody a lot of advice, and they have received it. It's very obvious they have.
Thank you, Mr. Tomlin. This time I'd like to ask if there's anyone ready to call the question to vote on the motion that's currently on the table. Mr. Dodd?
And yeah, I didn't actually amend my motion yet. I had mentioned an amendment date possible for the meeting between August 10th and 17th. So at this time, I would like to amend my motion to say that we would have an in-person meeting between August 10th and 17th of the Board of Directors.
So if I could restate your motion for the sake of the board, and correct me if I'm wrong, but you are motioning to postpone the start of fall sports until August 24th with a reconvening of this board in person no later than August 17th, allowing schools to resume summer workouts or conditioning. Which term am I supposed to be using? Please confirm, Mr. Craig, Mr. Damon or Mr. Dodd.
You follow summer policy would be the appropriate terminology, I believe. Established summer policy.
Okay.
Thank you, sir.
Established summer policy.
Thank you. So with that clarity, the motion on the table is to postpone fall sports, the start of fall sports until August 21st. Let me start over. The motion on the floor is to postpone fall sports starting until August 24th with a reconvening of this board by August 17th in person and allowing schools to resume following summer guidelines. Mr. Dodd, did I get that correct?
Yes, allowing summer guidelines to be followed until that point, correct, yes.
Thank you. Mr. Finlayson.
So he's amended his motion, and Ms. Patrica, who seconded it, needs to agree to that.
Is that an agreement, Ms. Patrica? Okay, so we have the amended motion and seconded. Seeing no further discussion, I'd like to call the vote. All in favor of Mr. Dodd's motion as presented, please raise your right hand.
I believe I have 11, Ms. Rohr, is that correct?
Mr. Harrison, I think, confirmed that. Those opposed, please raise your hand. For the record, Mr. Tomlin, I'd like to ask that we keep a track of opposed so we don't have that same situation in future votes.
We always do.
Thank you. All right, so the motion has passed to postpone you have a question, Mr. Finlayson?
When you're done, I do, yes.
So the motion has passed to postpone the start of fall sports until August 24th with an in-person meeting of the Board of Directors to be held no later than August 17th, and allowing schools to resume with, and I remember that last part, to allowing schools to resume with following summer policy or summer regulations. Mr. Finlayson.
Yes, since we're still at the same area and same topic, we did vote in our previous meeting to give schools consideration to extend their seasons past the end date of the season, if that was a more reasonable time for them to compete. Would there be any consideration from the board that we do the same thing, that if schools feel like it's going to be more reasonable for us to compete before the date starts, to remove ourselves from the state series, as Mr. Johns mentioned earlier, and to start at an earlier date? Just again, similar motion, it's just on the opposite, or similar idea, it's just on the opposite end of what we did on Monday night. And that would at least help us be somewhat consistent.
Mr. Ochoa.
All right, wouldn't let me unmute there for a second. I think what Mr. Finlayson's asking for is very consistent, and I think something that definitely needs to be taken into account when we look at these new recommendations that we're going to be brought or will be brought to us by staff. Because obviously, if we're delaying as we are, and without knowing yet how far we may have to delay, obviously we are going to have to look at that situation of possibly extending in order to go ahead and provide what I had mentioned Monday, a little bit of quality, not so much quantity, but quality in terms of seasons for all those sports.
Thank you, Mr. Ochoa. Before we continue further discussion, we would need a motion and a second.
All right, so.
Go ahead.
Okay, so I appreciate Mr. Ochoa's support, but he was headed on a different end of the season than me, I believe. So I would, and if it dies and if it's not appropriate, I certainly understand and respect that, but I would ask for the board to consider, therefore I would make the motion that schools who within their local decision makers feel that they are capable of starting on Monday be allowed to remove themselves from the state series competition and to be able to start on July 27th for a typical regular season, which would conclude all of their possibilities for competition for all sports.
Thank you, sir. Do we have a second on that? Mr. Johns has seconded that, so we do have a motion on the floor to.
I'd like to call point of order. I'm not sure that that's an appropriate motion, given the fact that I believe Mr. Finlayson, and I hate to be a jerk about this, but Mr. Finlayson was on the minority end of the vote that pushed back the start for all schools to the 24th. I rely on Mr. Ireland for.
No, you're not being a jerk. I can see where it would be perceived as a same issue, but that's not. I would have tried to make that amendment within that if I felt like it was a part of that motion. In other words, I see it as two distinct situations, but I'll respect Mr. Ireland's thought on that.
I'm not sure what the motion is. If it undoes what has been done, then obviously it's a motion for reconsideration and you cannot make that motion.
Okay. All right. So if we add to what's been done, is that undoing what's been done?
If it affects what's been done, it's a motion for reconsideration. As much as the discussion y'all have had respectfully, I think it was talked around.
Okay. So that would have to come from the dissenting side. So anyway, so that's my idea. If anybody wants to take up that cause, it would be appreciated.
Thank you, sir. There were other recommendations in the Sports Medicine Advisory report that, correct me if I'm wrong or out of line or out of term, Mr. Ireland, but all the remaining recommendations are incorporated into the FHSAA's return to participation guide that was submitted to the board, I believe, yesterday.
I believe that's
Would it be appropriate that we move on to Mr. Tomlin's action item or agenda item to cover these same recommendations that are currently in the SMAC report, to not duplicate it into different agenda items?
I'm not too sure I understand your question. If the information that's going to come before you based on your last motion would incorporate what is in that report or what is in the report that Mr. Tomlin put out, then I think you should probably wait until the meeting before the 17th to deal with all of that at one time. Otherwise, you would be just spending more time doing the same thing. Does that answer your question?
I believe it answers my question, but I guess, and maybe we need to continue with the first agenda item then if it's appropriate. There are items in the SMAC report that I believe could be approved now that have nothing to do with the start of play, that allow schools to get things in order. One of them being the discussion of a waiver that would allow school districts to present to their school district attorney, so that if we did resume on the 24th, those things, or when we meet on the 27th, schools have had time to already proceed with those items that may or may not be approved.
Now that I understand your question, yes, I think you can move on with those.
Okay, thank you.
Mr. Tomlin.
Let me go to Ms. Patrica and then Mr. Tomlin.
So I would agree with Mr. Ireland, because I know that there are some tweaks and fine tuning that Dr. Maynard would recommend to those forms. For instance, the checklist, for example, I don't think it has loss of taste and smell on there. And that's a big one that she's seeing with her pediatric patients. So I do think that we're ultimately going to end up rehashing things. If we're going to go to SMAC and say, hey, put together a comprehensive plan, I think that should be part of whatever comprehensive plan we put together. And I hear you about not giving schools time, but I believe that was the purpose of Mr. Dodd's motion, to make sure that it wasn't any later than the 17th, so that we did have time to roll this stuff out. I just want to be as accurate as possible.
I appreciate that. Mr. Tomlin.
Thank you. It is since the board has already made the decision to postpone fall sports, then we do not need to have either of the two other recommendations considered tonight that I had proposed. The summer policy will continue. Schools will continue to use whatever procedures they use to screen students, to take their temperature or whatever they have done. And during the time between now and you'd like us to report as a staff, then we would refine any kind of recommendations that the Sports Medicine Advisory Committee makes in concert with our other advisory committees, and come back to you with a little more definitive document than the one that we had here. Likewise, since you have already postponed the start of fall sports until at the least August the 24th, which is going to have an impact on some scheduling and some season dates and things like that, I would also be withdrawing the other recommendation that I had at the later portion. So at this time, I have nothing else to say in reference to that.
Okay, so Mr. Ireland, I would need some guidance here on the direction. If Mr. Tomlin is withdrawing his motion, his agenda action items, which would be the return to participation guide and this fall sports calendar end date. I do believe Ms. Patrica had added an agenda item, or yes, an agenda item.
I did, but I'm not going to make a motion to discuss or act on that at this point.
Thank you.
Oliva has a question, I believe.
Mr. Oliva.
Hi, Mr. Oliva.
I was going to make a motion to table the remaining action items to the next meeting.
We have a motion on the floor to table. Mr. Schusterman has seconded. Mr. Tomlin.
Thank you. I understand the tabling. If you table something, then we have to vote to take it off the table and then defeat it at the next meeting. Let's not compound the issue. I can't make a motion. That's a recommendation. And if I withdraw the recommendation and no one simply makes a motion to that recommendation, either one of them, it goes away a lot cleaner than tabling anything. All respect to you, Chancellor Lever. I understand what you're trying to do and I appreciate it, but I just assumed from the executive director is not going to make any request for a motion in reference to a return to participation plan, nor is the executive director going to entertain and ask for a motion to extend fall sports. That would come as part of our rather complicated and complex plan that you have given the opportunity for staff to work on over the next 3 to 4 weeks.
So Mr. Oliva, you are not making a motion to table.
Sounds great. Thank you for the opportunity to unmotion that motion.
I'm a little torn here with the agenda item to, I'm looking at the agenda item here. That was your second item, the fall sports calendar. I realize that we have postponed. I realize that more information will be discussed on the 17th for schools planning purposes. This could potentially still be a discussion that they could be working on, the option for us to approve if that's the majority of the vote of the board on this particular agenda item.
That is correct.
So someone would have to make a motion to accept make a motion as presented, and then it could be either denied or not. Mr. Finlayson.
So multiple folks have said how much we trust staff to come up with a really good plan. And I think it would be inappropriate for us to try to build that plan now. I think we should just yield to staff and then we may make tweaks to that plan, obviously, as witnessed tonight. But it is certainly, I think, in our best interest to put all of that off until our next meeting.
Okay, thank you, Mr. Finlayson. We did add 3 new items, one being new business. Mr. Ochoa.
Yes, I did want to add before you move on in reference to that action item that we're kind of putting off. I agree with Mr. Finlayson. I had a recommendation that I wanted to make with respect to this, that kind of address the minimum requirement of games in order to participate in the state series, because in that item, what was addressed was basically schools who opted out, but it didn't quite address the needs or concerns of schools that may choose to opt in. But again, respectfully so, without seeing what the staff comes up with, I'm going to withhold commentary until we meet again.
Till we meet again. Any other new business to present? Seeing none, I would go to Mr. Tomlin for Executive Director comments.
Thank you. I don't have any comments.
Thank you. At this time, we'll hold board comments. Mr. Tomlin, if you could help me keep track as I look at my screen and call on a board member if they have comments, for you to make sure I don't skip anyone, since my screen may not be the same as others. Mr. Ochoa?
Ms. Otero, no comments at this time. Everyone stay safe. And I look forward to seeing you again somehow, some way.
In person.
All right.
Ms. Totora?
I have no comments, and I echo what Mr. Ochoa said.
Thank you. Mr. Gertis?
I'd just like to say thank you to each and every single one of you on here. This is not easy, and we disagree on some things here and there, but you know, I think it was Dr. McDaniel said it's tough to do things in front of 4,000 people, but if people were able to see us at every single in-person meeting, The respect and the cooperation is unbelievable. And I respect and admire each and every one of you. Thank you.
Thank you, Mr. Gertis. Mr. Dodd?
Yes, I too wish that all you stay safe. I really hope we can get fall sports started and going. And man, I want to see kids have a chance to compete. And I really hope the SMAC committee, the coaches and athletic directors really take so much of what you all say, as it's very important to them. So I hope as you all work again on this plan going forward, that, you just know the impact that you have, and we want kids to be safe. And, it's important that, that's all understood by all of us. So thank you.
Yes, sir. Mr. Johns? Sir, you're muted.
No further comments. I haven't changed my stance from the beginning, and about 7 hours later, I think I've made enough comments. So thank you.
Thank you, Dr. McDaniel.
I also want to tell everybody on the board, I know it's a volunteer board, and obviously Mr. Tomlin and his staff are paid professionals, but we're all volunteers here, and this is our second job for most of us, obviously, and trying to do the best thing we can for kids. And we definitely need to listen to those folks that are giving us feedback from the YouTube and email and those kind of things. But we have great people working at the Activity Association, and we all want to do what's right for kids. And that's why we all got in the business. And it's a heavy heart when you put your head on the pillow and try to decide what's right. So hope everybody understands that. We're all trying to do what's best. And this is definitely uncharted waters. They didn't cover that in grad school that I went to anyway, how to handle a pandemic and keep everybody safe and still keep, kids deserve an experience. The first day of school should be a cool day. The first day of sports should be a cool day for kids. So it's up to us to find a safe and great path forward. So I wish everybody safety and see you soon.
Thank you, sir. Mr. Finlayson?
Yeah, again, I want to say how much I appreciate each individual, even when we disagree. Certainly our professional relationship and our personal relationship should not be compromised based on that. I have a great deal of respect for each one of our board members and staff members. But again, as Mr. John said, I do represent a certain contingency, and there'll be a lot of disappointed people in the North Florida area who are perfectly capable of starting on Monday. I don't want to belabor that point, but I do believe, since I do represent them, it's certainly part of my duty to make sure that that's known. Again, we can certainly disagree without being disagreeable. I hope that we've all felt that we've done that successfully tonight. And thank you all for the opportunity to continue to serve with you.
Thank you, sir. Mr. Thomas?
I have the utmost respect for this board and especially the SMAC committee. I want everyone to understand that it is important that we try as much as possible to do what is right for all of our kids. It is very important that we not put our own selves in person in front to make sure that's accomplished. It's important that we all, as Mr. Tomlin says, we should be as flexible as we can in making sure that all of our students are safe. Thank you.
Thank you, sir. Mr. Schusterman?
I just want to say that I always appreciate how much you can express how you feel and be able to communicate with everyone that's on the staff and feel comfortable doing it. I hope everyone is safe. I think we've done some things to ensure the safety of not only kids, but coaches, officials, teachers, and parents. And I think that's a great step that we took today. And I really appreciate being on this board. And thank you very much.
Thank you.
Be safe.
Thank you, Superintendent Moore.
Thank you, Ms. Otero. I just want to say thank you to board members and to staff for your commitment to quality educational programs and especially to safety of students. And it's a pleasure to serve with you and look forward to seeing you in a few weeks face to face. Thank you very much.
Thank you, Mr. McLean.
Yeah, I've enjoyed it. We've made a lot of tough decisions, and I know there's a lot of more tough decisions to come along about what we're going to do moving forward, and there's a lot of things we have to keep in mind from, do we want playoffs? Do we want regular seasons? I hope we'll keep in mind that we kind of got in and make sure the integrity of the FHSAA and the playoff structure, and keep in mind that the people in the spring, they didn't get a full season last year. So we've got to keep that in mind and talk about moving things back. I've enjoyed my 2 first board meetings that, Mr. Tomlin said, oh yeah, our board meetings last about an hour and a half, 2 hours, things like that. So I guess I'm glad that we get overtime, and I look for my check for overtime. And everybody in person.
Thank you, sir. Mr. Oliva.
Thank you, Ms. Sotera. I don't have any further comments at this time.
Thank you, Mr. Ward. Sir, you're muted.
Sorry. I'd like to say I appreciate everyone sharing. Of course, I was very silent tonight. I was listening a lot and a lot of great comments. And one of the things that I know I'm a big believer in is, sacrifice. I think that's something we all have to do. And sometimes, as we tell our kids, we're not going to always get the things that we want, but we have to meet somewhere in the middle. And so I think the tough decisions that we have to make moving forward tonight was definitely a sacrifice in a lot of areas. And so I just hope that we keep in mind, just the virus is not going to go away, and we have to find a way to continue to move forward in a safe manner. But we know that in due season, there will be more information, but we don't know. So right now we're fighting the unknown. But I think the decisions that we made tonight were something that can give us more information to be able to make a better decision. Thank you guys for all the information, and I look forward to the board meeting in person.
Thank you, sir. Ms. Patrica?
So just a couple of quick things. I have not really had to deal with COVID yet, believe it or not. And what I mean by that is, as a school board member in Lee County, I know that staff is working super closely with medical professionals in Lee County, and they're coming to us with recommendations. This required me to sort of dive into COVID a little bit and look at positivity rates and figure out what it means for the state, because this is a state decision that we have to make on this board. And Dr. Maynard was just so incredibly educational, I think is the word that I would use in talking to her. And of course, I went to Mr. Tomlin and said I'd like to reach out to her and ask ask questions about the report. And he said, go ahead. So I called her, and there was no question she couldn't answer. I'm just really, really grateful for her expertise. I want to talk to staff for a second and tell you guys, listen, this is hard. This is really hard. You're getting beat up by everybody. Everybody's beating you up right now, but I want you to stay focused on the mission and the goal. And the mission is children and making sure that we have hope and opportunity for them to play, and know that you have my confidence. You have my unfettered confidence. I know that you're going to come forward with a really, really, really great plan. So I want to offer you that support, and just keep doing what you're doing. Keep your heads up. Thank you.
Thank you, Ms. Patrica. I believe that is everyone. Is that correct, Mr. Tomlin?
Yes, ma'am.
Thank you. Just some comments in closing. I too appreciate the viewpoints of everyone on the board. I enjoy hearing different viewpoints to broaden my mind to make better informed decisions as I make a decision or support a decision, I should say. So I do appreciate hearing everyone's point of view. We are in a position that none of us have been in, none of us want to be in, but the reality of it is we're in it and we need to act. So I'm very optimistic and confident, as to use Ms. Patrico's word, I'm very confident in the work that the staff will do over the next couple of weeks. I have full faith that you all are the ones that are the right group to do this, along with the advisory boards that you'll be reaching out to. And I'm excited to see what will come out by the 17th when we meet together. I do want to give thanks to Dr. Maynard and Mr. Sefcik, who, as representatives on the Sports Medicine Advisory Committee, Dr. Maynard chairing it. I think you all have done a phenomenal job in very little time putting together information that allowed us to come to the decisions that we made, which I feel is best for the entire state and the most safest possible to operate at the time it is right to operate, not only, as someone else said, not only from our students, but also for our officials and coaches and everyone else that goes into having an athletic contest. So I do look forward to seeing everyone in person. I've enjoyed seeing you all on Zoom, but I'd rather see you in person. So until that date is, we will hear from Mr. Tomlin with a couple options and times to potentially meet. Mr. Tomlin, I am sincere in saying if we cannot meet in Alachua County, we can meet in Hillsborough County, which isn't that far considering where it is in relation to Gainesville. So I will offer that out there. But at the end of the day, I think we've had great discussion today. And I do wish each of you and everyone else listening on this call to stay safe, stay healthy, and have confidence that the right decisions are made with the best intentions. So with that being said, I will adjourn our meeting at 8:18. What is that, about an hour and a half, an hour and 45 minutes earlier than the last time. So have a good night. Thank you all. Listening on this call to stay safe, stay healthy, and have confidence that the right decisions are made with the best intentions. So with that being said, I will adjourn our meeting at 8:18. What is that, about an hour and a half, an hour and 45 minutes earlier than the last time. So have a good night. Thank you all.
At the least restrictive environment, we will need to work with families, but those students will need extra support. Okay, the AABB model, we're looking at it in many different ways. We're bringing teachers back together to make those decisions. At least at the elementary level, they felt really good about the A, B, and then C. When other districts have surveyed families about their preference between A, C, B, and they can do some cleaning during that C day. We found out that we could shift evening hours for our custodians and clean that night. Most families preferred having that C day on a Friday. That worked better with their work schedules. That worked better for activities that they could do with their students. That worked better for online learning on that day, carried into the weekend with we're hoping to do a lot of project-based learning with some of our subject areas as well. So it will be decided by teachers, but the biggest thing about the A, B, C, the teachers want that connection with the students and instruction, the relationship. Then the next day, the students could work on it and maybe still have some connections from home to the classroom. And then they'd be back again. The teachers did not want to go 6 days without that personal relationship with the students. They just felt like that was too long. So an instruction day, an online day, instruction day online, and then the C day. They're feeling like that's the best choice. Is there a perfect choice out there? No, there's drawbacks to all of them. But that's what they're leaning towards right now. We want the secondary to look at that and have more discussions. Families wanted that continuity from pre-K up to 12 with the schedule. So we're trying to keep everybody in the same place with that.
Excellent. I think Director Riley, did you have a question? I saw your hand up go earlier, and then we'll go to Mike.
Mine was answered. I was asking if we could just touch on special ed a little bit and some of those students. And so that's done.
Okay.
Okay.
Go ahead,
Awesome.
Mike.
Thank you. Director Potacek?
I've got kind of two questions here. They're kind of related together. And one is, it dates back to the survey feedback on last year and what you got and kind of looking forward. And you talked about the division between those who preferred distance learning and those who preferred or were more comfortable with the hybrid. But the question I have, and I think Carissa might have some observations, like when you took those surveys, was there any kind of breakdown between secondary and elementary? And it was interesting when you went through the model, because as I listened, I was focusing almost entirely on elementary. But it would seem to me as the model goes up and it's older, people are a little more comfortable with distance learning and more independence. Staff-wise, was there much comment on or much difference that stood out between what you're proposing for the elementary and what you were seeing at the secondary?
I can respond to your question about the survey. And I did share that at the last meeting, Mike. If you'll remember from the thought exchange results, we did see that our secondary families were more in favor of distance learning or an online feel, whereas our elementary and especially our early childhood really felt that that in-person learning was going to be their preference. I say that though, knowing that safety was also the top theme that came out of all of that. Everyone is concerned about the safety of their kids if they're in a school environment at all. And I think that also that message came across very clearly with our staff, and Melinda can touch on that more too, but we've been hearing from our staff in recent days that they are very concerned about safety, and that safety piece is across the board, but even more so I think at the secondary level, because if you just think about schedules, secondary teachers just have kids kind of coming in and out of their classroom throughout the day, which is different than an elementary teacher who's with the same group of kids. More or less, obviously specialists are kind of an exception to that. They too are more like a high school or middle school where you have kids kind of cycling through. So the safety piece is one we are hearing over and over from our staff, and understandably so. And the schedules that they're working out that Melinda touched on are definitely reflective of that, trying to find creative ways at a secondary level to minimize that exposure, so that you just are trying not to have as many of those transitions.
Yeah. So Carissa, are you saying when they're concerned about safety, it's of themselves and of the kids because
Both.
of crossing more?
Both.
Yeah.
Both, definitely. I think you see that clearly families are concerned about the health of their kids, our staff's concerned about the health of our kids, and our staff's concerned about their own health and the health of their own families.
Thank you.
Director Burns?
Thank you. Melinda, could you speak just a bit to the status of acquiring the technology tools that may be required as we come into the year? You mentioned some streaming capabilities and a wide range of costs that might be associated with that. But our clock is ticking. What is the status of actually acquiring those tools?
Oh, I was hoping John would come on. He has more detail than me.
Hey,
Thank
Jane.
you, John.
Yeah, absolutely. So streaming tools are complicated. There's a few things that have to go into doing really effective streaming of classrooms. And so we're looking at a few layers. The first layer is we've rolled out a number of document cameras throughout the district as a part of our literacy program. And one of the neat things about a document camera is that you can use it to show a book or something you're working on, but our document cameras have flexible arms so that you can show the whiteboard or you can use it just like a webcam. And we know that if teachers are doing any kind of streaming or recording like that, they're going to need cameras pointed in a variety of places. So the document camera provides that cheap entry solution to make sure everybody has the basics. Beyond that, we're looking at 2 cameras that are on order for testing in classrooms. One is the OWL cam that has a 360-degree camera that can look in different directions so that it can have a focal point on the teacher's teaching space and the whiteboard and possibly the students in the room to really make that a more immersive experience. And then the next step is a mounted camera that has 2 focal points that you can switch between. A lot of this has to do with cost though. So what Melinda gave you was a wide range in cost. You know, a document camera is about $400 a classroom, and many of our classrooms already have them. On the other side of that spectrum is the mounted Logitech camera. Now you're dealing with suspension mounting, maybe some electrical wiring, some in-wall wiring to get the data cabling back. I would estimate that at around $2,400 per classroom. And we have about 500 classrooms in the district. So been talking to the principals about this and agreed we're really going to start by using our document cameras, doing our flipped instruction, where teachers are recording mini lessons that students can watch online. And then as we as a district, we have the training, we have the financial resources, we can look at which of those 2 streaming, either the OWL or the Logitech camera, makes the most sense to start putting in classrooms so we can train and implement and train and implement. And then it's always complicated. You know, we could rip the Band-Aid off and spend $1.2 million and put this streaming technology in all the classrooms, and maybe we're done by January, and things start to go back to normal, and it doesn't get a lot of use. So we're kind of trying to balance that. You know, how long is this going to last? Is this a 1-year thing? Is this a 2-year thing? Is this a 3-month thing? With how much we're investing in the technology. So probably going to put a lot more emphasis on the Chromebooks and the document cameras at this point to make sure that teachers and kids are connected online, and less emphasis on the more expensive technologies that are used for synchronous learning.
And just thank you, John. Thank you very much. Just as a follow-up, might it be a strategy to have just a certain number of rooms in each building have that capacity where, you know, a teacher could use that room if they had a lesson plan for that day that would utilize those higher levels of technology?
Yeah, 100%. And I think that's where we're going to do our first layer of rollout, is in those common spaces that teachers, you know, check out and use, places like the forum room at the high school, or the smaller theater spaces at Stillwater Middle, so that exactly what you're saying. Because another piece of that too is teachers getting a comfort level and then putting a lesson together that's going to require that, right? The cameras themselves don't create the professional development or the lesson. So I would agree with you completely that we start in the common spaces and go deeper as it makes sense.
Thank you.